Surgery third annual open house event. We are so excited the day has finally arrived. We've been working towards it. We're ready for it to get started. In the past 2 years, we've held this event live here at this location in Brentwood. We've had a great time, great food, great snacks, glass of wine. We've got to see our providers do some of their presentations. We've been able to talk to the doctors in their panels. But this year we're changing it up. We're coming at you live on Instagram, Facebook, or YouTube. I'm so glad you're with us though. We're going to be doing many of the same things. We're going to be having presentations from many of our providers. The doctors will be here with their panels in the same way, and we'll even be able to take questions from you out there in our viewing audience. So let's get started. My name is Angel. I've worked for Dr. Moore for over 6 years here at Cool Springs Plastic Surgery. Dr. Moore started the practice over 20 years ago at our original location in Cool Springs. That location is still there. He has also added a location in Mount Juliet, Music Row, and then of course this great place in Brentwood. In Brentwood, Dr. Moore was so excited to get this on the road because he was wanting to have his own OR on site. He wanted to be able to see his patients, do consults, pre-ops, post-ops, surgeries, all on the same location. And he and Dr. Sarosiek are both able to do that here. It is a beautiful facility, our operating rooms, and you are going to get a tour of that. I'm going to take you through that tour. You're going to get to see how fascinating it is, and it truly is just that, fascinating. But the main reason we're doing this is so that you get to take advantage of great promotions. This is our biggest promotions of the year, biggest savings that you can get, and that's why we're doing it. We don't want you to miss out. If you go to our website, csps.me, there are several links you can click. One of them will be frequently asked questions. You can read through that. If you have any thoughts, any questions, hopefully they'll be answered there. Another link is the schedule of events. It's going to talk about the different things we're doing through the day. You can spend the whole day with us, 12 to 7. We would love that. Or if there's something specific you want to see, then you just come on during that time, watch that, and you'll get all the information, hopefully, that you will need. And then there's also the link to shop online, which is what you're going to want to do if you're wanting to partake of one of the packages or get one of the specials for Botox, of course, all of our favorite things, Botox. And then, of course, if you have any questions, you're not able to do it, you're concerned that you're not getting what you need, please call our office, 615-771-7718, and there will be people on the phone, awesome people on the phone, that are going to be able to answer all your questions. They can even help you make that purchase. So, are we ready? Because we're ready. It's going to be incredible. Let's get started. Hello, we're back. So here we go with our first demonstration of the day. Let me introduce you to Heather Happy. She's a licensed esthetician here at our Brentwood location, and she is happy. We do love Heather Happy. So she's going to be talking about lasers. I'm going to hand the floor to her.
All right,
It's all you.
Angel. So today we're going to be doing lots of live demos, but because of the noise of the Halo and BBL device, we just can't do that today for sound reasons. So we're going to have some video looping on the back screen for you to watch. But what I want to talk to you today about is the Cyton device, which is the BBL and Halo. So BBL stands for broadband light, which is also intense pulse light, but it's branded through Cyton, and that's why they call it BBL. So what makes BBL different from IPL is it just gives us a broader range of wavelengths that we can treat more issues. The Halo is a laser, and we'll talk about that a little bit later, but those are the two devices that we primarily use in the non-surgical department. So BBL, what does that treat? The main thing it's going to treat is pigment, and it also stimulates collagen, so it's anti-aging. So if you have brown pigment, so that's sun damage or freckles or just age spots from over the years, or redness like rosacea or acne, broken blood vessels, the BBL is really going to be the best option to treat those. And like I said, it's also anti-aging, so it's going to give you some collagen stimulation as well to work on those fine lines and wrinkles and texture of the skin. So with BBL, there are a couple of contraindications to when we don't do those. The first one, which is one of the most important, is sun exposure. So sun exposure 2 weeks before or 2 weeks after the treatment is going to cause a lot of complications, which could burn the skin, blister, scab it up, and cause some pigmentation problems. So you want to make sure that you're really out of direct sun for a couple of weeks before and a couple of weeks after the treatment. That kind of gets into a negotiation phase with some patients about how much sun that is. Typically, if you're outside for more than 45 minutes to an hour with sun protection, that's a bit too much sun because we don't want you to have any kind of sunburn or any kind of tan coming into the office, or likewise having the treatment and then getting out in the sun after. So this treatment really is best to be done in the fall and winter when our sun exposure is more limited. The other contraindication is sunless tanning or spray tanning products. Even the glow creams that you do at home, we don't want you to use those over the area to be treated for about 4 weeks before the treatment. And then the last one is going to be more for darker skin tones. So IPL and BBL is a serious contraindication for darker skin, simply because we can hypopigment your skin or make it a lot lighter than your natural skin tone, or hyperpigment, and that would make it darker than your natural skin tone. So BBL and IPL are not appropriate for darker skin tones. So when you come in for your treatment, basically what you're going to do is get your picture made. We'll do some consent forms. I'll cleanse the area that we're going to be treating. Our most common areas are chest, neck, face, and also the back of the hands, but we can really treat anything that you want at all. But once we cleanse the skin and get you ready to go, I do explain everything to you prior to the treatment, but you'll experience 4 things with the treatment. You'll hear a beep of the machine. You'll see a bright, startling light. Now you're going to have goggles on to protect your eyes, but you'll still see that light. You'll feel a snap like a rubber band, and then it's also going to get warm. And that happens every single time we do the treatment. It is a little bit uncomfortable, so I have some things I can do to make it more tolerable for you, but it is a little bit of an uncomfortable treatment, although most people can tolerate it just fine. The first thing whenever I get started, I apply an ultrasound gel over the skin. That's used for 2 reasons. It's allowing my device to glide easily across the skin, and then it also acts as kind of a conductor to release the heat that's in your skin and let you cool down a lot faster, kind of like when you apply aloe vera over a sunburn. So the treatment itself, this is going to be showing us a treatment of a chest. We do multiple passes over the area. We follow what's called the Forever Young photofacial protocol. So we do passes for red pigment. We also do passes for broken blood vessels, specifically for working around the face. And then we do passes for brown pigment as well. BBL is best done in a series, especially if you've never had them done before. So it's best done in a series of 3. They're usually about 3 to 4 weeks apart, and that all depends on your schedule. And then after you do your initial 3 treatments, then you can probably get by with doing those just once a year annually. Or if you've started working on your face, then you can eventually move on down to your neck or chest if you'd like to do that. Downtime really varies per patient, but if you have a lot of brown pigment that we're working on, you can expect your brown spots to be a lot darker for about 7 to 10 days after the treatment. Now, they're not going to be textured or flaky. They're not going to fall off like what a chemical peel would do, but you might feel them just a little bit. They're commonly described as coffee grounds. But one thing I do want to point out is if your brown pigment, your excess brown pigment, is not that dark to begin with, don't expect your brown spots to be significantly darker. So just kind of keep that in mind. They do microscopically exfoliate away at about 7 to 10 days. The other thing that can happen is potential swelling. Now, this is hit or miss with BBL. Some people swell the first time and not the second time. Some people swell a lot the second time and not the third time. So it really is going to depend on you and your skin. Primarily, if we're working on a lot of redness, like rosacea or broken blood vessels on the face, you will probably go ahead and swell a little bit more. Swelling is typically going to be about 2 to 4 days with BBL, and of course that varies, but it could look almost like you've been crying all night where your eyes are a little bit puffy, or you could even be a little chipmunky just across the cheek. And there really isn't much we can do about that except just to prepare you for it. Also, we can find that you could bruise a little bit. So the little broken blood vessels on the face, they're weak because they're there for a reason. And the energy from the BBL is pretty intense. So that could pop one of those little blood vessels and you might get just a small little bruise over that area. The good thing about BBL is you could put makeup on immediately if you needed to. So if you were going to go out and run errands after your appointment, you could bring makeup with you and put it on and just go on about your day. Don't plan anything important socially for at least 5 to 7 days after the treatment. So don't put it right up against like a wedding or a vacation or anything like that, just because we don't know what your downtime is going to be like. The next thing we'll talk about is going to be the halo. So the halo is not like the BBL, it's an actual laser. So remember, the BBL is a light treatment and the halo is a laser. So the laser is going to give us multiple depths or wavelengths that we can treat the skin. And the things that we treat the most with halo are sun damage, textured skin, lines and wrinkles. We can work on pore size, redness, rosacea, acne scarring, traumatic or surgical scars. Those can all be treated with halo. The thing is about halo, while we can treat all of this, you have to really prioritize what you want treated first. So if you want to work on tightening and firming, then we need to do a halo specifically customized for that. And then if you want to work on pigment, then we need to do another halo specifically targeting pigment. So we really can't treat everything at the same time, although you do see benefit from both treatments or from treating one over the other, but you will need to plan on doing a couple of halos. Now, the halo is a bit more uncomfortable than the BBL. So traditionally, we have just done topical numbing cream like you would get for filler or microneedling or things like that. But over the past several years, we've added Pronox, which is laughing gas. It's the same thing that they do at the dentist office, and that's what I typically use for all of the halo treatments. We can also use it for the BBL if you want as well. So the laughing gas is really going to significantly cut down on the discomfort during the treatment and also work on your nerves, because when everybody comes in, you're going to be a little bit nervous. So it's going to help relax you with a little bit of your anxiety that you have. With the gas, you don't have to have anybody come with you. It's out of your system within a few minutes, and typically within about 10 minutes, we can let you go. But the halo is a lot more uncomfortable. You will experience certain things with it. You won't see that bright light that you see with the BBL because this is a little red laser. So you won't see the light with that. You won't hear the kind of popping or the startling sensation that you feel with the BBL because the halo is just more continuous. So that's going to kind of be going on the whole time you have your treatment done. The downtime with the halo, a bit more significant than the BBL, but also very predictable. So when you are done with the treatment, you're going to be hot for about 30 minutes to an hour. And usually if you live kind of locally, by the time you get home, it's getting a lot more tolerable for you, but it is going to be pretty hot. Throughout the day, your skin will just continue to be red, but it's going to feel more like a sunburn throughout the day rather than that intense heat from whenever you were finished with the treatment. The next thing you're going to experience, though, is the next morning when you wake up, you're going to be intensely swollen. So I cannot explain this enough that you will be very swollen after the halo, especially if you add a BBL on top of it. because there's just a lot of inflammation and histamines happening in the skin when we do the halo. So you will be very swollen the next day. And then the second day is worse, surprisingly, but the second day is worse. And then day 3, it's going to start getting a little bit better. Day 4, significantly better. The swelling is much, much better on day 4. The way you can help with the swelling, if you're able to take NSAIDs like ibuprofen or something like Aleve, you can take those before the halo and kind of throughout the day. You can do antihistamines like Zyrtec or Claritin. You can even take some Benadryl at night. Sleeping elevated will help with that as well. And this is the same for BBL if you're concerned about swelling. But sleeping a little bit elevated is helpful as well to cut down on the swelling of the halo. The biggest thing is just be up and around. You don't have to be bedridden after you've had the laser. Staying upright as possible is going to help cut down on that swelling. Now, while you're getting to peak swelling about day 2, your skin's going to start getting pretty rough and flaky, and that's going to be essentially the burned skin that we created with the laser. That's going to need to start exfoliating off. So that flaking skin is about a 5 to 7 day process, and then it just kind of exfoliates away, and then typically by day 7, your skin should be pretty smooth. So whenever we're talking about downtime with the halo, 3 days of swelling, about 5 to 7 days of the flaky, dry skin. About day 7 is when your skin should be getting much better. So I wouldn't plan anything socially important for at least 5 to 7 days, if not just a little bit longer with the halo. It's best also done in a series. While I don't necessarily want to do 3 halos unless you have significant issues that we need to work on, usually people can get by with just 1 or 2 halos initially, and then at least 1 per year, or sometimes you can stretch it out to every other year if you're taking really good care of your skin with products and other treatments in the office. If you have lots of things that you want to work on at the same time, if you have a lot of sun damage or freckles or rosacea, you want to work on tightening and firming, then it's a really good idea to put them together to do the BBL and halo at the same time. You'll have a little bit more downtime, but it really won't extend out past that 5 to 7 days, but it really gives you the ultimate rejuvenation whenever you can do them both at the same time. Now, if you were thinking about any of the packages that we have today for this special, we have the bronze, silver, and gold package. If you were just thinking about 1 BBL and 1 halo of your face, then you definitely need to do the silver package. If you want to add any other body parts to that, if you want to throw in your chest, you want to do your neck or your hands or anything like that, you'll want to go ahead and do the gold package. I have had several patients today and yesterday want to do all of it at the same time, all the BBLs and all the halos at the same time, and they ended up buying a couple of packages. So that would really be a good way to save extra money and then get those credits that we have through the office and also the extra skincare products. So I think Angel has some questions. Hopefully that's been helpful. I know it's been kind of fast, but I hope it's been helpful to give you information.
I do have some questions, and also know that we're struggling, obviously, casting our 2 videos, the BBL and the halo. We are going to download that onto YouTube so that you can watch that in a little while if you would like to. It'll be available for you. And know that the one for the chest was the BBL and the one for the face was the halo. And then also remember the packages that she talked about. So, questions. What is the usual downtime for the various facial laser treatments? I think you talked about it a little bit, but remind us.
So BBL brown spots are increased, and that's going to take about 7 to 10 days for those brown spots to microscopically exfoliate away. You don't see them falling off. So about 7 to 10 days for those brown spots. They do reach their peak darkness at about day 2, and then they start getting better after that. Swelling, variable with BBL, it could be anywhere from 2 to 4 days, maybe up to 5 days of swelling. Sleeping elevated, antihistamines, NSAIDs like ibuprofen, Aleve, those are great to do as well. And then bruising, that's kind of hit or miss. It could be a few days for that, or if you take a long time to heal, it could be a little bit longer than a week. But you can put makeup on after that. Halo, hot, really hot for about 30 minutes to an hour. Then a sunburn feeling the rest of the day. When you wake up the next morning, intensely swollen. For those of you who have face recognition on your phones, it won't work. Just trust me on that.
That's right.
It won't work for at least 3 days. Flaking skin about 5 to 7 days. Typically by day 7, you should be pretty much back to normal. That's for the face. Neck, chest, hands, those take a little bit longer to heal, but they're also a little bit easier to cover up.
And I was going to say, it's not like you're down as in surgery. I mean, I came to work day after. I did too. And you did too, and we all do. Now, we work here, so that's awesome for us. But I went to church, I went to the movies. You know, I was a little swollen or a little scaly, but I did say I want to wear a button that would say, look at me next week, because it's going to be even better. Yeah. But it's not like you're laying in the bed recovering.
No, and I tell patients, because I have patients that, I mean, they might be my first appointment in the morning, and they come in for their lasers, and they've got full face makeup on because they don't want anybody to see them driving through the Kroger parking lot with their makeup not on.
Right.
My thing is, it depends on your level of confidence. Yeah. We don't care what we look like. A lot of people don't care. Go out and do whatever you need to do, stay out of the sun, but just who cares, really? Right. Now, if you care and you're worried and concerned, don't plan anything special. Don't plan on a dinner night with your girlfriends or, you know, going out with the guys or whatever. Just don't plan anything special, but please just don't stay in the bed or in the house. That's not necessary to do that.
Right. Great. So what is the best laser treatment for fine line and skin texture improvement?
Halo is going to be the best option for that because it's going to help with the crepiness of the skin. So fine lines are typically a little bit of crepiness, so it's going to stimulate collagen production. And then, what else did you say?
The texture? Skin texture.
The texture. So Halo is going to be better for that because it essentially burns off the skin. So it burns off that texture. Now, with that being said, for those of you who have like the age spots, or like my mom calls them liver spots, it's like the little black kind of crusty spots, or even the pre-cancer cells like the actinic keratoses, Halo burns those off. So that's going to make it a much better result. So I would do the Halo for that. If you're nervous about the Halo, which don't be, but if you are, do the BBL instead, or we have other treatments that you could do.
And Pro-Nox is our friend. I agree with you. That was, it really changes the game.
It's amazing. It's a game changer.
Yes.
I have patients that are so against the gas. They only want the numbing. They come in an hour early. They get numbed. And then the problem is with not doing the gas is you're still going to feel a lot with the numbing cream. And then if you're in pain, I guess, or discomfort, I can't go to the setting I want to use. I have to back it off because you're uncomfortable.
Right.
So it's really better to just let me do the gas.
Right. And in the picture that was frozen on the screen, she had the Pro-Nox too.
Was it Olivia?
She was, and that's what she was doing, was inhaling some of that Pro-Nox. Next question, and I think this one's so good. Which laser treatment is best for acne scarring?
Halo is better for acne scarring because here's the thing about scarring. The scar will always be there because it's just damaged tissue that's just thickened and fibrous, so the scar is always going to be there. What the Halo will do is take laser channels and kind of burn through those fibrous strands and help to kind of break up that scar tissue. So the Halo is going to be able to treat the scars much better than really BBL would or chemical peels. Microneedling is a good option for scars, but the Halo is going to help with the acne scarring. Downtime is going to be a bit more. You'll be pink a little bit longer because the settings are probably one of the more aggressive settings we do because we really have to blast down through those fibrous tissues. Expect a couple of treatments, 2 treatments, maybe 3 treatments, depending on how bad the acne scars are. I oftentimes will like to do a series of microneedling treatments first to get the skin kind of prepped and ready to go using good retinols or Retin-A, tretinoin products, and then get you ready for the Halo. In more of an extreme case, then you could end up doing, depending on skin tone and things like that, you could do the CO2 laser with Dr. Moore or the TRL, which is the big version of the Halo, and that would be with Dr. Sarosiek. Those are surgical procedures, though, so they wouldn't be something we would do up here.
Right. And if you call in and ask about this and are wanting to schedule one of these procedures, we're always going to say absolutely, but we're going to get you a consult first, and Heather's going to talk about all of those things. And if it is acne scarring, she would give you all the steps and get you on that road to help you get rid of those scars. Okay, next question. Are BBL laser treatments safe for melasma patients, or could this make the condition worse?
So BBL and IPL together, they are pretty much, they stay away from doing melasma, specifically if you're doing the wrong settings. So if we're doing the wrong settings for melasma, that can flare it and trigger it and make it come out worse. And I've actually had this with patients that we didn't know they had melasma. We thought it was just brown pigment or sun damage. We did a BBL, it looked great, came in to do the second BBL, and bam, there was their melasma. Now it calms down, it diminishes, over time, but I don't like to do BBL for melasma specifically. I prefer to do halo for melasma because I can tune the settings a little bit more appropriately with the halo. And then I also do a melasma peel that we have in the office called the reverse peel. So for melasma, I like to do a chemical peel, topical skincare products like a pigment corrector and a retinol or Retin-A, halo. We oftentimes have to do all of these together, obviously not the same day, but a series of treatments to give you the best results.
Right.
Melasma won't ever go away, but we'll be able to diminish it as much as possible.
Over time, yeah. And then which laser is best for deep wrinkles?
So if you were seeing us non-surgically or me non-surgically, I would do the halo on you for deep wrinkles, and we would need to probably plan on doing about 3 treatments. If you wanted something further, then you would see one of the surgeons for CO2 or TRL, potentially even a facelift if you need that. And that's something about our office is when you come in to meet with us, because we do have plastic surgeons in our own surgery center, if we think that what we can do for you non-surgically is not going to give you the results you're looking for or expecting, we'll be very honest and say, I think you need to have a consultation with one of the doctors. Or likewise, they might see you for a consultation and say, why don't you go upstairs and get a laser consult, because I think that would be better. So we really want to be able to give you the best option. Although it might not be what you had anticipated, we really want to be able to give you the best option.
Right. Very honest. And then let's see, can the Halo BBL be used on chest and arms? I believe you talked about that.
Yes, and the thing is, I've talked about this before, the thing is about the face, neck, chest, or whatever, so many of us work on our faces and spend a lot of money on our faces with our Botox and filler and our skincare products and our facelifts, but we really neglect the neck and chest. And so, yeah, if you have this looking really nice, we do need to move down because this is kind of the picture frame of where everything is. So I would absolutely do BBL and Halo on the neck and chest, hands, lower arms. It'll be great.
Yeah. So she talked a little bit about the packages, and it is best to do a package for this. So you can call in at the office, or you can go to the shop online and click on that link and then buy one of those packages. There is options for the special on just 1 and 1, but oftentimes you might need more than 1 and 1. So that's where you may have a question. So, any questions? Let us know. It's been so informative.
Thank you.
Would all love our skin to look just like this. It's beautiful.
Thank
just
you.
so beautiful.
Thank you. It's a good skin day.
That's great. And so, stay tuned. We'll be coming up next with something also just as exciting. So we're back again. This next presentation we have for you is from awesome Michele, who is one of our nurse injectors at our Mount Juliet location. Michele Bailey has years of experience as a nurse injector. She has patients follow her all over Middle Tennessee. When she was here at this Brentwood location, when she was at our Cool Springs location, and now to Mount Juliet, where she is busy all the time. You will be so impressed, and tear trough filler can be a really difficult area. So she's got it down. We have multiple providers that do that procedure at our multiple locations. Dr. Moore has seen to that training himself, and it's great, the results that we get. So here we go, Michele Bailey.
Hi everyone, I'm Michele Bailey with Cool Springs Plastic Surgery. I'm a registered nurse injector. Been with Dr. Moore a long time, and today we're going to show you tear trough filler. A lot of women ask about it. They'll come in saying they look tired, or they have hollowing underneath, or dark circles, and it's really good for all the above. Now, I tell patients that if you have eye swelling or have a lot of problems with allergies, you may not be a good candidate for it. So we really do need to consult with you ahead of time to see if you're a candidate for it or not. The things that we tell our patients are the procedure really is relatively comfortable, believe it or not. You would think in the eye area that it'd be a little uncomfortable, but it's not bad at all. We have our patients watch for excessive swelling or any color changes after their filler, and basically they do great with it. If you're not a candidate for tear trough filler, sometimes you're a candidate for eye surgery. So I tell patients, just if you're not sure, come on in, let us take a look at you and consult with you and give you our advice on it. Now, I've got a patient that is in here that's ready to go. She's already been numbed. We typically numb you there, and she has been told all the risks and complications, and we're ready to watch inject. So follow me. Hi, Miss Jamie.
Hello.
And we're gonna go ahead and get started. Feeling kind of numb, or it's kind of hard to tell in that area?
Hard to tell.
A little bit. So as you can see, we've already numbed her. So we're gonna go ahead and at least get one side done today. During our filming, we will definitely do both sides before she leaves. But for time's sake, we may only do one for the camera. All right, and that should feel kind of like a little weird feeling. Yeah, absolutely. All right, and we're going to clean you off with some antiseptic, so look up for me. There we go, good job. All right. And get it good and dry. Now we're going to be using a cannula for injection there. Cannula is much softer than a needle and less swelling and less trauma to the area. So, Jamie, relax your cheeks for me, and then I want you to close your eyes for a minute. There we go. I'm going to measure, and you're going to feel me touch you. Okay? And I will warn you before we do any sticks or anything. Okay, very good. All right, and a little stick. Great job. How was that? It should have been like a 2 on a 1 to 10 scale or less.
Not bad at all.
Great. All right, and here's where I want you to tell me if you have any discomfort or pain.
Pressure.
Pressure? Okay, pressure's normal. Perfect. And we are beautifully placed. So I'm going to pull back, so make sure we aren't in a vessel or an artery. And you're going to feel a little pressure there. Should not be having any pain. Beautiful. Doing good. How are we feeling?
Totally fine.
All right.
I don't really feel
Good
anything
job.
right now.
And look up for me, open. Great. And as you can tell, it's already filled that hollow there. Great. And look up for me, like all the way up. Great. And relax. And you can see the difference between the two sides already, how she's filled out through here, and it's not as dark. She doesn't have that darkness that she had there a minute ago. So we just kind of massage the area through here. And with her, she's got a little bit of hollowing over here, so I'm going to go in here next and do this area. Give her a little bit through there. So you doing okay, Miss Jamie?
Mm-hmm.
All right. And just relax. I'm going to measure here. Jamie doesn't have a lot of swelling or issues with that kind of thing, so she's a great candidate. Now, as you notice, she's very dark complected, and darker complected people can be kind of tricky because sometimes they will present with a dark area there, and a lot of it can be actually discoloration of the skin. With her, she's got a little discoloration, but not bad at all. And how we doing, Jamie?
It's fine.
You're cracking up because camera's in your face, I'm sure. And relax that chin. There we go. Beautiful. Great. And then we just kind of massage to make sure it's nice and smooth. Great. And sometimes you'll get a little tiny bruise right where the insertion site is, but she's really not going to have any bruising except maybe this one spot, tiny, tiny. And I'm going to show her. And what do you think?
Looks good.
Yep, and see we put a little bit in here too.
Awesome.
That's great. So that's got
Okay.
one side done. And I'm going to hold a little pressure here just so she doesn't get any bruising here. So you had no pain?
Mm-mm.
See, it's relatively easy to do. And please, please, if you get tear troughs done, go to an experienced injector. You want to know how long they've been doing it, how many they've done. This is an area that can be dangerous. So you do not want to go to somebody that doesn't have experience in this area. Very good. Did great. All right. And we're ready to do the other side. Thank you for watching. We've really enjoyed doing this, and as you can see, it's not that painful at all, and pretty easy to do. So you guys have a great day, and give us a call.
Welcome back, everyone. Here we are. This is a very exciting part of our practice. We have Coolsculpting expert, Destiny Berger. She's also one of our licensed estheticians. Now, just to let you know, our Coolsculpting happens only at our Brentwood location, just because that's where our machines are. But we would love to schedule a consultation. You get to see it in action right now. Take it away.
Exactly. Thank you, Angel. So like she said, I'm Destiny, and I do all of our Coolsculpting consults and treatments in our office. This right here is my lovely patient, Star, and we are going to have her answer a couple of questions for us a little bit later on. But Coolsculpting treatment, and by really, really cold temperature. So the ideal candidate has soft, squishy, pinchable fat that's going to be able to be sucked or placed into the applicator. Typically, I tell people the treatment doesn't hurt, but when we first get you hooked up, it's really just going to be the suction. So it has to have a good firm grab over the area so that it doesn't slip or slide around or kind of run the risk of popping off during your treatment. So when I first apply it, it's just strictly the suction. So you can kind of feel a cramping sensation, maybe a little irritation or kind of like a stinging. When I first get you hooked up, I'll typically put a strap over the area or secure it with a pillow, something like that, just so it has a little bit of something to kind of hold it in place during your treatment. Once I have it nice and secure, that's typically whenever I will turn the coolant on the machine. So whenever I turn the coolant on, you'll kind of feel somewhat similar to a pins and needles sensation, really only happening the first 5 to 7 minutes of your treatment. I tell people it feels similar to if you were to stick your hand in like a cooler of ice water looking for a drink, kind of that tingling pins and needles. So really whenever you're getting your treatment and you're hooked up, kind of like Star is right now, we have a big room in the back where we actually do our Coolsculpting treatments. We have a big TV, you can watch Netflix. Sometimes people will bring in their laptop or their iPad that you can get work done. You can be on your phone. Sometimes people will even take a nap. And so you can do whatever you want. I always tell people the most important thing while you're getting your treatment in the office is that you're not shifting or moving around a lot, just so we make sure the applicator stays in place, it doesn't slip or fall from the area or end up losing suction. And typically each applicator is going to be attached to you for 35 minutes or 45 minutes, depending on the applicator size that we've specifically chosen for your treatment plan. So during that time, you'll run the full cycle or the full applicator time, then I'll come back in the room and we'll remove the applicator. Typically your skin is going to look a little bit red or somewhat irritated. It kind of looks just like a sunburn just in that specific area. It'll also look a little bit raised or kind of swollen just for the first couple of minutes typically. We just do a massage over the area that kind of helps everything level out and go back down to normal. The tissue will also feel a little bit more firm in comparison to its normal soft squishy texture or consistency. So it'll kind of help warm the area back up. We mostly do it for results sake though, just because with Coolsculpting, sometimes some of the fat cells in the area that we're treating have maybe only gotten halfway treated or 3/4 of the way treated. The first couple of minutes while the tissue's still cold or the fat cells are still cold, we can further break those up. The more likely those ones will be to die essentially and get flushed out of your system with the rest that did get the full treatment. I typically tell people that that's the time frame that you'll experience the most discomfort, if any. Usually some people are completely numb and they really only feel the pressure of me kind of pushing on the area during the massage. Other times patients, like me included, feel like my skin is a little bit more sensitive. Whenever your skin is exposed to normal temperature again, skin, you can feel kind of like a stinging warmth sensation and feel somewhat similar to that pins and needle sensation too that you've kind of felt during your treatment in the first couple of minutes. I say usually that's done within 3 to 5 minutes. Typically, by the time we hook you up to your next applicator, you feel basically kind of back to normal. So that's everything that you'll experience during your treatment and immediately after. The good thing about Coolsculpting is that you can drive yourself. You don't have to worry about any injections or anesthesia or incisions or anything like that. It's completely non-surgical and non-invasive. So really, we're just breaking up those fat cells with the really cold temperature, and your body ends up processing those and just flushing them out naturally through your lymphatic system. A couple of things that you'll kind of feel in the next few weeks or experience after your treatment. Tenderness and soreness, I would say, typically only the first couple of days, maybe 3 to 5 days or so. You can feel a little bit itchy in the area while your nerves are regaining their feeling, and numbness can actually last anywhere between a week, maybe even upwards of 4 weeks or so. Me personally, I kind of hold on to that feeling for about 3 to 3.5 weeks. It's nothing that affects your day-to-day at all, so you can really come in, get a Coolsculpting treatment, and go straight to working out if you want to. And then another thing that you can experience too, maybe a little bit of swelling in the area. Typically, that's only something that you yourself would notice. It's not going to be anything too drastic. And then just because of the suction, you might have a couple of little areas of bruising, and those can go away anywhere between maybe a week up to a week and a half, just depending on how quickly your body can heal from those. So after your treatment, Coolsculpting's typically done or started with 2 different sessions. So it's definitely not a one and done treatment, similar to liposuction would be, or a different surgical procedure. So in order to get the 20 to 25% reduction in the area, we're doing 2 different sessions. So the first time you come in, we can treat your abdomen and your arms, we can treat your abdomen and flanks, really wherever you want. Knock all of those areas out in one day, and then 30 to 45 days later, have you come back in and we'll hit those exact same areas again just to get that full 20 to 25% reduction. And typically, whenever you do come back in for your second treatment, if we're about a month to a month and a half out from your first session, we're already going to be starting to see results in the areas that we've treated. So at your first session, we of course always take your before photos just to track your progress, but it's just fun to take updated photos in between that month to a month and a half out from your first session, just to see the results that you're already kind of starting to have. From your second session, it'll take about 2 to 2.5 months, maybe even 3, to see your full result. So the process definitely doesn't happen overnight. It's not super instantly gratifying. It just takes your body that amount of time to process those fat cells and kind of get rid of them naturally. So Coolsculpting is something that's very individual to each person. Sometimes people will come in and say, hey, you know, this area, it's really been bothering me. I just want to treat my lower abdomen. That patient maybe only needs 2 different cycles, one kind of on each side. Other times people will come in and say, hey, my full abdomen is usually my stubborn area. I can't really seem to shake it or get rid of it with diet or exercise. Or people who have been dieting or exercising that have kind of hit a plateau. They're kind of seeing results everywhere else besides this certain area still. That's when we can treat the patient. So Coolsculpting is typically ideal for people who are between, I would say, 15 to like 25-ish pounds of their ideal weight. The more tissue that someone has, or the larger the area that someone has, the more Coolsculpting treatments that will be needed. And kind of the larger the area, the longer your treatment would be, or the larger your quote would be, essentially, which we have a lot of good package pricing options depending on certain areas that you want to get done. We can kind of group all of those together for that reason too. So like I said, it's typically ideal for someone who's more active, doesn't fluctuate in weight very often. They're just kind of at a set weight, and this area is just a specific little peak area that they really want to just work on minimizing. A couple of things that Coolsculpting does not work for is cellulite, stretch marks, and skin tightening. I feel like majority of the time someone will come in and say, hey, you know, I really want to treat this area. I have some fat here, but they might have a little bit of loose skin. That could be for multiple reasons, just aging in general. Sometimes someone who's gone through a larger weight loss might have little bit of loose skin left over from that, or just women with pregnancy, you can have a little bit of skin laxity from that. Sometimes that patient might not be the ideal candidate, just because if we're reducing fat from that area, if we reduce the fatty tissue from behind looser skin and we're not tightening the skin, sometimes you'll kind of run the risk of having loose skin left over from your treatment. So we definitely don't want that to happen. So I'll tell you if you're the ideal candidate for Coolsculpting, and I can give you a good idea of how many treatments that you'll potentially need going forward. And then we can get you all set up with your first treatment, schedule out your second treatment, typically after your first, and then your follow-up from there. So that's basically Coolsculpting in a nutshell. So Star here is actually treating her abdomen today, her lower abdomen, and this is her second treatment. So we actually did her abdomen and her flanks the first session a couple days ago. She's about four and a half weeks out from her first session today, but we already treated her flanks on Monday, and then we're treating her abdomen again today. So from this point, we'll schedule her follow-up for about 2.5 to 3 months from now. So Star, how did you feel when you first came in for your treatment? Were you nervous? Were you anxious? Were you just excited?
I was excited. I had read about it and thought that it would work just because there's no downtime.
Yeah, yeah.
And I wanted something that wasn't going to prohibit me from having a good summer.
Yes.
Yet still treat the areas that were not going away at all.
Yeah, perfect. Yeah, and that's what is really intriguing to people majority of the time, is that there's no downtime from Coolsculpting. So you can start right before summer and not have to worry about like compression garments or surgeries or scars or anything like that. How do you feel whenever you first get hooked up to your treatment?
At first, like on the abdomen, you have like a little bit of cramping feeling until it pretty much goes numb after about 5 minutes.
Yeah. Do you feel that pins and needles sensation?
Not at all.
Okay, good.
Nothing.
And she is
completely comfortable.
Yeah, good. Well, she is about 20 minutes into her 45-minute cycle. So she actually has about 25 minutes remaining. And usually, even before we even started the live, she was a couple minutes in and she already felt pretty comfortable during her treatment too. So do you feel like, since you're about 4 weeks out, that you've maybe started noticing results at this point in your flanks, or like your clothes fitting a little bit differently already, or just visually seeing a reduction?
Visually, I can see it. Of course, it's, I don't know. I want to see the before and after pictures, but I can already see a difference. Yeah,
it's just fun to kind of see what you've done already in about the 4 to 6 week mark whenever we do your second session. So I think we're going to have Angel come back on. And Angel has actually done a couple of Coolsculpting treatments too. So what was your experience like with yours?
I've done my arms twice, this area. You know, that area that starts to hang down and flap like a chicken. And so I've had 2 sessions on that, and I do feel that has absolutely tightened that area. It's so much better. That fat is gone. Love it. Would highly recommend it. And so I was very pleased.
Good.
Yeah.
And how did you feel like you did during your treatment? Like, did you experience any of the discomfort? How did you feel afterwards?
You know, it was not uncomfortable, and it's nice because we have the 2 machines, so we were able to do both my arms at the same time, which is so nice. Kills that you're faster. You get it done much faster. So I had both my arms propped up. I was watching Netflix. Of course, you feel the cold.
Yeah.
It kind of zaps you, and it takes your breath away a little bit, and then it just starts to dissipate.
Yeah.
The second time when we put the vacuum on, it felt a little more prickly. And then it was the same thing. I didn't feel anything after that.
Yeah.
Yeah.
And that's a good point too, is that sometimes when someone comes in for their second session, you can feel a little bit more irritation just because there's less fat that we're targeting. So you can feel an increased sensation just with like the stinging or irritation or that really cold temperature, or even whenever I remove the applicator and we do the massage, you can experience a little bit more discomfort during that time too. And another thing that Angel just kind of brought up, which is another really good point, is that we have 2 different machines in our office, which is great because we can treat areas at the same time that just don't have any overlap. So for Star's abdomen, we just have her hooked up to 1 cycle right now, but when we treated her flanks or her back, we got both of those applicators hooked on at the same time instead of having to run 1 35-minute cycle on one side, removing it, and then hooking her up to the other side. So depending on the area that you want to treat, we can definitely dual sculpt and hook you up to both, kind of like what we did with Angel's arms, which is really nice, and just cutting down your treatment time because it can definitely rack up in the hours that a patient can be in the office for sure. So
It's very helpful. And I love how when you talked about the second time around, there can be a little more stinging because there's less fat. Well, I am good with that. If there's less fat, I'm all right with that.
Exactly.
So it was very nice. We do have some questions from our viewers.
Perfect.
Is that good?
Yeah.
And how are you doing, Star?
Doing fine.
Doing great. She's doing very well. And you may have said this, where all can Coolsculpting be done, and
Yes.
where all can it not be done?
So we can Coolsculpt almost every area that has that soft, squishy, treatable fat. So we can treat underneath the chin, we can treat arms. Women or men can both do their back area, their flanks, abdomen, of course, lower and upper, and then we can actually do inner and outer thigh, and we can actually treat this little pocket of fat too that some women kind of struggle with like tank tops and things like that, and we can treat right above the knees if we can get good suction there too. So really anywhere that you have soft, squishy, pinchable fat, or any area that we can actually get the applicator hooked up and with good suction.
To attach. And you even mean that bra fat above here even? Okay.
Yes.
Okay, good to know, good to know. Will Coolsculpting results be permanent? Does it require maintenance treatments after the initial set of treatments?
This is another really good question. So the treatment and the fat cells that we kill will actually never come back. So it does make Coolsculpting a permanent fat reduction treatment. I always tell people that if you maintain your body weight, you'll maintain your result. So of course, if you come in, get your treatment, years later, you can definitely come back in and retreat the area. If you haven't gained weight, then you should have been able to maintain your result, which is really nice. The thing to consider too with Coolsculpting is that since we're targeting 20 to 25% of the fat cells in the area, the other 75 to 80% can still fluctuate in size. So that's another reason why it's ideally for someone who's not going through different weight fluctuations, just because those fat cells in the area can still get larger if you're to gain weight, so you can definitely still gain in that area. Or if you were to lose weight, of course the area and those fat cells could still get smaller as well.
Great, great information. does Coolsculpting for double chin have advantages over Kybella? And you may need to explain a little bit what Kybella is.
Yeah, so it is actually really common for someone to come in and get a Coolsculpting consult for underneath the chin and treating or wanting to reduce that area. Sometimes someone doesn't want to have to deal with needles or injections that Kybella really has in order to do your treatment. And so if someone just doesn't want to mess with that, or Kybella also, you get pretty swollen. And so you can expect much more swelling with Kybella just because there's multiple injection sites. I tell people, you kind of look like a little bullfrog after Kybella. With Coolsculpting, there's no injections, there's no needles. You might be the tiniest bit swollen, or you might have a couple little areas of bruising, but it's not quite as dramatic as Kybella would be. And I just think Coolsculpting is probably a little bit more comfortable just in general because we're just chilling the area, whereas with Kybella, you know, they're doing multiple injections. But with that being said too, someone might come in and not be a good candidate for Coolsculpting in this area. Sometimes people will come in and not have enough tissue to treat there, and that's typically when I would refer to one of our nurse injectors, and they can kind of meet with them about Kybella options.
Can you do Coolsculpting and Kybella?
You could, yeah, if you wanted to. Yeah. Sometimes people will do Coolsculpting underneath their chin, but sometimes people will have a little bit of jowling, and Coolsculpting is really only going to treat right underneath your chin and right underneath your jawline. If you're wanting to treat this area as well, you can definitely use it in combination together.
Great, great, good information. And I think you did say how soon you will see results.
Yes, so 4 weeks is typically when I say that's when you'll start noticing a difference. Sometimes I'll even call a patient a couple of weeks, maybe 3 weeks out just to check on them, and they're already saying that they've kind of visibly noticed a reduction too. But typically I'll just say about a month.
Okay, all right, and then, and you may have said this too, how much time is needed then between treatment sessions?
Yes, so you definitely have to wait 28 days. I typically say anytime between 4 to 6 weeks, just because we want to be able to get you your results as quickly as possible. If you were to come in, get a treatment, and then wait 3 months, we're spreading your results out over the course of about 6 months or so. So the sooner you come in, about that month, we'll be able to get your full result set in about 4 months instead of pushing it out closer to 6 to 7.
So it's about getting quicker results,
yes,
then is what that's doing. Great, great, good information. This is an interesting question. Can I get Coolsculpting if I'm considering getting pregnant soon?
Yes, so it definitely will not have any effect or bad result with you wanting to get pregnant. Coolsculpting is honestly more of like a natural process, and because there's no incisions, there's no surgery, there's no anesthesia, injectables, or anything like that, it definitely shouldn't affect you at all.
That's great information. Can you exercise afterwards, or is there no sweating, that turnover time for sweating?
So you can definitely come in and get a treatment. I've actually done a couple of Coolsculpting treatments on some CrossFit instructors, and they've come in, been my first patient at 9 a.m., and then they've gotten their treatment and gone straight to the gym to train.
Wow.
So you don't have to take any time off. It's not necessary. If you feel a little bit tender or sore in the area, you might, you could even just take a couple of Tylenol or ibuprofen to help with that, but it's not necessary or mandatory to take time off.
Right, right. That is so good to know.
Which is great.
So last question, and then we'll go on and talk about options for patients. The mechanism action of Coolsculpting, if fat cells return, I'm not sure I understand. Can fat cells return, I think is what they're asking.
No,
okay.
So they definitely don't. The fat cells that we kill will absolutely never come back. By the time you're done with puberty, you already have your certain amount of fat cells. So the ones that we kill, they're absolutely never going to come back. So that does make it a permanent fat reduction treatment, which is awesome.
Great. Is there anything else you want to tell before I talk about options for patients?
I think that's it. I just want to say, if you're interested in Coolsculpting, I would love to meet you and have you come in and come up with a good treatment plan so we can get you started on getting the ball rolling and getting your results.
Absolutely. So, Coolsculpting is considered our non-surgical lipo treatment. It doesn't require any incisions. We do require a consult for it to happen. So you would need to call the office, 615-771-7718. Get on the books with Destiny for a consult, and she would talk about your options. Now remember, we're not going to recommend something to you that's not going to be successful. If she thinks it's a better route for you to go a different way, she will totally recommend that. That's what we're going to do. We're going to do what's absolutely best for our patients here. So you can call today, talk about the packages with one of our awesome phone people. Is your best bet for Coolsculpting. But packages to buy, which is like money on your account for you to use toward this procedure. Now, another little hint I wanted to tell people. Father's Day is coming up. This is a great treatment for men. It's not intimidating for a man. Nobody knows they're doing it. There's no downtime. It can be a secret. But there's some men that might really enjoy this procedure. So that's an option.
Very true.
So please call our office if you have any questions. Click the link to shop online for the packages. Destiny, star, it's been awesome. You've been a great patient.
She has.
Very informative, Destiny. If you have any questions, give us a call. We'll see you at the next presentation. Okay, here we are. I'm back. This is Angel. And for this part of the event, I'm so excited. You're going to get to tour the operating room here at Cool Springs Plastic Surgery. Dr. Moore had a vision a long time ago of starting this, having his own operating rooms where he could do his procedures on site. And that's how it works. Most procedures are done on site here at the Brentwood location at Cool Springs Plastic Surgery. Now, before you get to do that though, you call the office, you set up a time for a consultation with one of our awesome phone people. They'll answer the phones, you'll ask the questions that you may have, they'll help you as much as they can, and then they'll talk you through the process. Once you're on the books for your consult, you'll come in, you'll get to meet with Dr. Moore or Dr. Sarosiek. You'll ask all of your questions, they'll give you their thoughts, they'll give you their recommendations, and from there y'all get a plan of action. Once that is done, you'll get a calendar date on the books. You'll move forward with that. Once that date arrives, you come here, and this is where you'll come in to have your surgery. We'll get to go see that. We'll walk up the stairs. I can't wait. It's awesome. So, you're here for your surgery. What a great day. You're going to come up to the second floor. This is where our 2 operating rooms are located. You'll head in this way and get to meet some of our pre-op nurses and get started. It's going to be great. Follow me. So, here's Olivia. Let's head into the pre-op room, and here we go.
Hi, I'm Olivia. I'm one of the pre-op nurses here, and when you come in for surgery, you'll come in this way, and then we're going to take you into a little pre-op room where we're going to get you ready, okay? All right. So we're going to bring you in here today, and with the procedure, I'm going to have to sit here first of all. We're going to go through a few things about your medical history in this room this morning, and today we will have you talk to the surgeon in just a little bit. Yeah. He'll come in, he's going to talk to you, he's going to go through everything y'all have talked about preoperatively. Anesthesia is going to come in and meet you. He's going to sit down, go through all your medical history, talk to you about the anesthesia you're going to have today, okay? We'll get your blood pressure, your temperature, kind of get your vital signs, make sure everything's okay. Any questions you might have, we'll go ahead and go through that. We also will go through some information as far as what to do when you leave here today. At this time, you won't have any medicine that's going to make you sleepy just yet, because we want to make sure that you are comfortable and talk to your physician and surgeon about everything you went through, okay?
Right.
And when you go home, we give out printed instructions. Your family will be notified during the procedure. We will call them from the room. We notify them, update them a few times. At the end of the procedure, the surgeon will call and talk to them personally, go through some things and steps about going home. And then we'll get you changed in the pre-op area and get you a gown, get you a warm blanket, and get you settled and comfortable on the stretcher. And then, like I said, the surgeon's going to come in and talk to you, okay?
Okay, so at this point, Olivia, I might be a little nervous, have a little anxiety.
Yes.
I'm still going to get to talk to my doctor and my anesthesia provider.
Yes,
Am I going to get a little medicine to calm my nerves?
Yes, you will. And I know that, everybody is very nervous when they come in and scared. That's why we are here with you in this room to provide you what we can to make you feel better and to give you the best care. Your surgeon will talk with you, like I said, and then anesthesia will come in. As soon as everything is answered and you've gotten changed, you've gotten a warm blanket, then we'll get you on the stretcher, we'll get a little IV going. When you're getting ready to go back to surgery, after everybody's talked to you, then we will give you a little medicine in your IV, okay? You'll start feeling a little bit as you leave this room, and then when you go down to the OR area, you'll be very relaxed. Most people do say they do not remember even going in the room, okay?
So this is good news. I was going to say, to have the medicine that relaxes you, you don't have to be anxious and full of anxiety. And then once you are ready to go, Olivia, sweet Olivia, as well as several other of our great OR nurses are going to be available to make sure that everything goes so smoothly, as well as Dr. Moore and Dr. Sarosiek.
Right.
They are top of the game, those guys. Amazing doctors. So from here, we get to act like we're on our stretcher and get to see the most shiny, beautiful part, which is the operating room.
Yes.
So let's head that way.
And one thing too.
Yes.
And, I'm not sure we covered this, but when you go back for surgery, we reassure your family. We call them, talk to them, give them an update or two just to let them know that everything's fine in the operating room. Give them an update of progress of the surgery, any questions they may have or concerns, and then we will also call them at the end of the procedure.
Great.
Your surgeon will. And they'll call, talk to you, go through everything as far as surgery, little things to look out for when you're going home. And then we will give you all kinds of information for your family, printed instructions, and we also, with any family member has any questions, anything like that, we make sure that they are on board with everything. They will have number access to get in touch personally with their physician that night and the next week. It'll be
great. So that's so great. They're going to call my family along the way, reassure them, make sure they're feeling well. I love that they're communicating with them all along the way. It's not just scary, because they too will have a normal. I'm not going to be by myself. There's a team with me. I'm on a I don't have on my earrings or my makeup. I have my glasses, which they've taken away. Don't have my contacts in, things like that. Also notice my beautiful hair. I've got my beautiful hat on. Super, super sanitary and sterile. This is the area that nobody can really go in unless they're covered. Normally I would have my socks on. We would have shoe covers, all kinds of things. That is one thing we do pride ourselves on, is the safety of our patients. So we make sure everything is sterile and safe. So, but here we go. This is exciting. Shiny, clean room. Follow me. So here we are heading into the OR. Very safe, very sterile, very sanitary. This is Lynn, one of our OR nurses. We have great staff here at Cool Springs Plastic Surgery. Super caring, very, very nice. They want to make sure that I'm going to feel comfortable, safe, and warm while I'm having my surgery. So let's head in.
Let's do it.
Here we are. Isn't it beautiful? So safe, so sterile, very clean, state-of-the-art, awesome operating room. And we're here with Lynn, who's one of the team that's going to be in the operating room with us, as you remember. So, who all's going to be in here with me, Lynn?
So, the surgical team consists of the surgeon, the RN, who would be me, the circulator, an anesthesia provider, also a first assist, and a surgical tech. So there's a large group of people who will be here taking care of you.
And let me just say that even though our OR is just 3 years old, our team has many, many years of experience. Dr. Moore handpicked all the great people that works here at the office, as well as all of our locations, and he picked a great team. Lots of experience, no newbies. We know what we're doing. So, what's going to be happening on this end?
So what will happen is we will wheel you in and we'll just switch you from the stretcher to this OR table. Anesthesia will be standing at the head of the bed. I will be hooking up your compression sleeves that will be going on and off during surgery just to prevent blood clots. Josh will be hooking you up to his monitors, an EKG, a blood pressure machine, and a pulse ox, and then I'll have our surgical tech and our first assist over here, and then the surgeon will be standing on the other side. Once we get everything hooked up and we're ready, Josh will, or whoever our anesthesia is, will just ask you, it's time to go on vacation, where would you like to go? And then he'll put you to sleep, and then the rest is just us. And
And then Olivia reminded me that y'all are calling my family along the way.
Yes.
And so is that you or somebody else on the team?
That would be the circulator or me, whoever's the nurse in here that day. To let the family members know that we're asleep, everything's going well. It's very nerve-wracking. Make sure that they know.
Now, everything went beautifully. OR with me the whole time.
And once we get over here, I will give her a quick report as we'll did and how it went, and then it'll be Olivia recovering her.
Yes. And
So, what happens now?
okay. Circulator, we are going to have you on this stretcher. A lot of monitors. We always do the first thing we do when you come in. You'll be very sleepy. You will not remember any of this at all. We want to make sure that everything's fine, okay? We'll put a little probe on your finger for oxygen. We hook you up to an EKG machine just to make sure everything looks good. And we get your blood pressure. It will go off quite a few times while you're here in surgery, that hour, okay?
And so that's kind of like what you've seen on TV.
Exactly.
The beeps are going off, and that's all very normal.
It's very normal.
Okay.
You're going to hear people talking. You're going to hear us covering you up. We're going to hear us positioning you. And then you're going to start waking up, and we're going to, first thing we're asked you, how are you doing?
Right.
And then we're going to also explain your surgery is over. You're in recovery room, and everything is fine. And at that time, your surgeon always is in here in recovery with you when we're waking up, and we'll sit you up, get you comfortable, and then when you're awake enough to know that you want something to drink, we'll get you something to drink. And at this time, we'll start assessing how you're feeling and what your needs are.
That was my question. So, am I going to start beginning to maybe feel a little pain at this point?
Yes, and everybody will feel a little bit of discomfort. And at that time, we'll ask you, we do a little pain level. We ask you 0 is no pain and 10 is the worst. And indicate what we need to start doing to give you pain medicine. Ready to go home. All right.
And so about how long will I spend in recovery? So we've had our surgery. We have finished in recovery. We have all of our clothes on. We're in our wheelchair. We're going to go meet our loved ones. They have been communicated with all along the way. They're very comfortable with what's going on. Also know that you have a phone number. Dr. Moore and Dr. Sarosiek are easily reachable if you have any questions or concerns along the way. It's not like you're going to go to a voicemail and maybe somebody will call you back. You will be able to call and speak directly with your surgeon. They're very good about that. And that's the good thing about Cool Springs Plastic Surgery. We are hands-on. We want to meet our patients' needs at all times. Always. We want to be available. So remember, if you want to call for a consult, 615-771-7718. You can talk to one of our awesome phone girls, maybe me, and then you can get that on the books. So remember, for the event, you can click on the link and you can you do the shop online. And then remember, you can call the office if you have any questions, and then you can call the office and schedule your consult for your surgery. So Welcome back. Wasn't that so interesting? Get to tour our OR. We're very proud of that facility. So our next segment, so excited. Dr. Sarosiek, board certified plastic surgeon here at the Brentwood location at Cool Springs Plastic Surgery. He's going to be talking about all things breast. This is our breast panel. I'll come back with questions after you do your part.
Angel, thank you so much. Appreciate it. And hello to everybody out there. I'm Dr. Conrad Sarosiek here at Cool Springs Plastic Surgery. I'm just here to give you guys a little bit of an overview about breast surgery. And I wanted to thank each and every one of you for joining us today, whether you're joining us from home or a place of employment, to let you know that this is our first ever virtual open house, our third open house, but first virtual. So bear with us as we try to kind of put together a program for y'all today to hopefully educate you about some of the amazing surgeries that we do here, but also the amazing treatments that we offer with skincare as well as with the injectables, Botox filler, etc. So thank you guys so much for joining us, and let's get started. First and foremost, it is about 2:30 here in Nashville on a beautiful Thursday. I will say that this is right about the same time that a lot of kids are going to be getting home from school. So if you are a mom and you are at home sitting in front of a laptop and you're expecting your children to come home, just be aware that we do have some photos of patients, their before and after photos on the screen. So if your child does happen to walk home, make sure you have the ability to kind of click off the screen and minimize that screen so you don't show it to your children. One other thing I wanted to say hi to my mom, who's actually watching and live streaming this event as well, and to all the moms out there, happy Mother's Day, and thank you for doing the hardest job out there, and that's being a mom. So here we go. Here's our agenda for today. We're going to be talking about breast augmentation. We're going to be talking about breast lift. We're going to be talking about breast reductions, breast cancer reconstruction, revisionary breast surgery, and then we're going to talk briefly about combining breast surgery with other procedures that encompass what we would call the mommy makeover. So let's get started with the infamous breast augmentation. So many women, hundreds of thousands of women every year get breast augmentations done in America. There's so much that goes into that procedure, and I would urge every one of you who is out there who is potentially thinking about having a breast augmentation done, do the research, do the due diligence, and make sure that you are able to answer certain questions for yourself before you finally sign on the line and sign up for a surgery. Those things encompass understanding what incision is my doctor going to make this procedure a success. Number two, am I going to be using an implant? And if so, which kind of implant am I going to be using? I will throw this in here that we at Cool Springs, we do offer fat grafting to the breast. I'll mention it briefly. We do take patients and do liposuction on thighs, abdomens, flanks, and take that fat, process it, and inject it into the breast to help give a more natural look without the use of an implant for certain individuals. That procedure, however, is not for everyone. So this is where having a discussion with your surgeon and making sure that you are aware and they are aware of your desires come to a nice medium. You also want to make sure that you understand for your surgery, where is the doctor putting my implant? Is he putting it under the muscle or over the muscle? And then to discuss the size of the implant. This is probably one of the most important things to talk about, is the size of the implant that's going to be put in your chest to give you the desired look that you want. So let's first touch upon incisions. And I want to ask our crew here to kind of zoom in on this slide. The breast augmentation procedure can traditionally be done through several different incisions. The transaxillary, or the incision in the armpit, is a great idea for an incision in that it produces a virtually scarless breast because you're able to put the implant in through the armpit area. There are some drawbacks to that procedure in that it does lead to some patients having a lateralization, or the implant will move laterally on their chest. There's also a higher risk of having some complications when you have an implant put in through that area. So while it's something that can be done, traditionally, the more common ones are the ones that are done on the breast, the periareolar and the inframammary. The periareolar is a great incision for folks who aren't really bothered by potentially having a scar around the nipple area, versus the inframammary is a great incision. And I think a lot of the incisions that we do here at Cool Springs Plastic Surgery revolve around this incision because of several factors. One, it's very clean. Number two, the scar will be virtually invisible. In a couple of years, you will almost not even be able to see a scar. Number three, the incision has very low risk of having any complications. And those are all important things that you have to be aware of when choosing an incision for your breast augmentation. moving on to the types of implants. Traditionally, we are looking at 2 implants, saline and silicone. Very simple, saline and silicone. There are pros and cons to each one. I will tell you that a lot of the pros and cons revolve around having an informed discussion with your plastic surgeon. Saline implants, if you're a woman who has a very thin chest and does not have a lot of fat tissue on her chest, putting a saline implant underneath of the skin can produce what we call in the industry a phenomenon called rippling. Rippling can be slightly disfiguring in that you can see indentations in your breast when wearing a low-cut dress or a bra or a bathing suit. So be mindful of that and have that discussion with your surgeon if he's making a suggestion for you to have a saline implant versus a silicone implant. Silicone implants are wonderful implants. They feel very different from saline implants. This is probably one of the most important things for you to do with your surgeon is sit down and actually feel the implants and know what you're going to be putting into your body, because you ultimately are going to have to live with this decision for a number of years after your surgery. So choosing the right implant, super important, but you're not going to make that decision on the internet. Go meet with your surgeon, have them help guide you in the appropriate track to make the best choice for you and for your breast. Now, we get a lot of questions, women coming in because they see a post on Instagram saying, hey, I want a breast augmentation. I saw so-and-so had one done and they had a high-profile implant. So what is profile? What does profile mean to the patient? What does a profile mean when discussing an implant? So this is a schematic. You see 4 different implants here on the screen. This one is very short. Then you get a little bit taller, and the tallest is all the way on the right side of the screen. Profile discusses how wide and how tall an implant is. Low profile implants, all the way on the left side of your screen, are implants that are very flat. They're flat, they don't have much projection when they're put inside of the chest. However, they're wide, they're very wide implants. As you move from low profile to moderate to high to extra high profile, what essentially you're doing is you're creating a higher or more projecting implant. So the implant comes further out from your body, but the actual width of the implant gets a little bit narrower. So this decision about which profile to use, it's not a universal one. There's not one profile that works for every single patient out there. This again stems into the discussion point with your surgeon. Hey, what's the best implant for me? What would match my attributes of my chest? What matches my breast footprint on my chest? And the surgeon can help point you in a direction of either using something that's a little bit of a lower profile or something high or something just right in the middle. Implant placement, and this is another question that a lot of women come into our office with during consultations, and they're asking, how do I know if I need an implant put under the muscle or over the muscle? And what we've kind of shown here on this schematic is this is a breast, and I'm going to ask the guys to kind of zoom in on here. We've got a breast here, and this outer pink edge is the skin. The yellow in here is really the fat or the adipose tissue inside of your breast. The pink is the gland inside of your breast that produces milk when you're pregnant and then collapses after pregnancy. And see this red thing right here? This red structure right here is called the pectoralis muscle. The pec muscle is what we are all talking about when we say, hey, my implant's under the muscle or my implant is over the muscle. And you can see that when you shift from this schematic to here. This implant, this blue structure here, is placed under the muscle. If you look here, you see the red muscle up and the implant is under it. On this side here, however, you see that the implant, the blue, is sitting here and the red muscle is still in that same place that it was before. So this is an implant that's over the muscle. This is under the muscle. What's the advantage? Great question. For a lot of folks, putting the implant under the muscle allows the muscle itself to be elevated up, and by elevating it up, you lift all of this extra tissue on the breast up. What that accomplishes for patients is it provides them with extra upper pole fullness. That upper pole fullness is what creates a better contour of the implant on your chest. Is that right for everybody? It's not. There are certain women that's not the right way to go. But for a lot of women, this presents a nice opportunity to enhance that upper chest, which for so many women becomes very thin, especially as you age. So what's the deal with placement of an implant? Under the muscle is under the pec, over the muscle is on top of the pec muscle. On top of the pec muscle, you don't get that extra fullness on the top part of their chest. You get a nice shape at the bottom, but the top part of the chest remains flat. And again, I stem back to the same point. Have that discussion with your surgeon. Make sure that you are both on the same page prior to committing to surgery to understand the pros and cons of doing it either way for your surgery. Here's a young woman who came to us who had a nicely shaped breast. However, she wasn't happy with the volume in her chest. She wanted to have more fullness. She wanted to have a better shape to her breast. She wanted to have the ability to fill out a bathing suit, to fill out a dress. So what we did for her is we put in a fairly large implant. She has about a 400 cc implant that was placed in the submuscular or subpectoral placement. So again, she wanted to have more fullness here. So we placed it underneath of the muscle, and you can see her chest from this picture where literally almost her entire shoulder is visible, and she has a very flat chest up here, to having a much more elevated and a much more smooth transition between her upper chest and the actual breast structures themselves. So simple example of a breast augmentation using a smooth, round implant placed in the subpectoral pocket to produce a nicely shaped, nice result. Now let's shift gears a little bit. We're going to talk about mastopexy right now. So now we're going to shift gears away from implants, and we're going to go back to kind of talking about the breast and how to lift that breast up. So breast lift or mastopexy allows us to deal with this phenomenon. And this is a great schematic. I show this to all my patients to help explain what happens to a woman's breast over time. So a young woman, a breast bud begins to form, and you have this nice breast tissue that's located high up on the chest. This blue line runs in what we call the inframammary fold, or the fold underneath of the breast. And over time, the breast will move from this position to this, to this, to this. And you see the nipple that's grayed out here is slowly moving down to the point where grade 3 ptosis or sagginess is producing an implant that's facing the floor. So what do we do during a breast mastopexy? Is we try to get women who have breasts somewhere in this range, try to get them somewhere in this range to give them a more youthful appearing breast and to help get that nipple pointing up in a forward direction. A lot of times women will ask, well, what about incisions? I know that because this is not an augmentation, that because this is going to be a breast lift, I'm going to have more incisions. So in effect, that's very true. Because of the fact that we have to take out the lower part of the breast and lift that whole breast up, we have to make more incisions. However, those incisions produce a scar pattern that for most women turns out to be very, very low, not as visible as you would think. So this is the nipple. The scar pattern here is, you can trace it around the nipple here. You can trace it down to the bottom of the breast, and occasionally you can trace it down along that inframammary fold. Now that scar pattern varies, and it's not the same for every patient, and it all really depends upon how much breast tissue we have to resect and how much breast tissue we have to reorganize on the chest to produce that elevated pattern. Some folks might get just a scar around the nipple to produce a lift. Some folks will get the lollipop scars commonly used. The lollipop scar is a scar around the nipple and a scar going down to the bottom of the breast. Some folks get this anchor scar, which includes a scar around the nipple, down to the bottom, and along the bottom here, just like that. So there's a lot of variability in terms of the scar pattern. Most folks, they have to have a discussion with their surgeon to determine which scar pattern they might end up with, but very important to understand that prior to going into surgery, because you don't want to wake up from surgery and look at your breast and see scars that you did not expect. So have that discussion with your surgeons, and they can help clarify what they're doing. Here is another example of a woman who underwent a mastopexy, so no implant. We did a breast lift on this woman. You can see here the outline of her breast. Here's her nipple location. You can see how flat her breast is here. Look at the after picture. Notice the nipple position. It went from being here, the nipple went to being here. So the nipple is now elevated. Her breast comes down flat, has a nice round curvature, and a nice fold underneath. Notice that position of the nipple shifted. It went from here up to here. However, look up here on her chest. This woman does not have a lot of extra tissue up here. We did not put an implant in to help enhance that look. So again, why is it important to meet with a plastic surgeon? They'll be able to help explain to you the advantages, the pros and cons of doing a breast lift versus a breast lift with an implant. doing a breast lift with an implant, you can see here, take a look at this lovely woman. So she had a breast that was sagging, just like the previous woman was here, and she desired to have that breast lifted up. In order for her, she did not have a very thick breast. There wasn't very much tissue, and she wanted to have more volume, more filling of that chest. So for her, an implant was the perfect choice, combined with a lift. And as you see here on this picture, she has a nice shaped breast here. Her nipple is up. She has a full breast that's very full on the top part of her chest and gives her that extra fullness that she so desired. So lots of different ways of combining surgeries. This is a very important one to understand, how that implant combined with a mastopexy will help produce a much more raised look. Now, breast reduction is a great procedure. A lot of women suffer from shoulder pain, neck pain, back pain. We offer breast reduction surgery. Sometimes that surgery can be done through insurance, sometimes not. One good way to find out is to do a consultation with your plastic surgeon. Here is a typical incision pattern that we utilize for a breast reduction surgery. And then here's what happens after. Again, the scar from a breast reduction largely revolves around that anchor scar, a scar around the nipple, a scar going down to the bottom, and a scar along the vertical. Sometimes that horizontal scar across the inframammary fold can be avoided, but it varies patient to patient. So this can be covered for insurance. When you do decide to do this procedure, the insurance companies can kind of give you feedback if that's appropriate for you. These symptoms that women have, the shoulder pain, neck pain, back pain, are almost instantaneously gone. So if any women are out there suffering from that, I would encourage you to seek out your plastic surgeon and have a nice discussion with them. We also offer breast cancer reconstruction. And here, in 1998, there was the Women's Health and Cancer Rights Act that was passed by Congress. And this act made it mandatory for insurance companies who were allowing and covering women who underwent a mastectomy or a resection of their breast for breast cancer. It made it mandatory that those insurance companies had to cover breast reconstruction. And for us here, what better way can we serve than helping women achieve the look that they had either before through performing and allowing ourselves to help take care of these folks in breast cancer reconstruction. There are so many different ways to reconstruct the breast. There are so many different ways that you can recreate the breast, from breast tissue in the belly, implants, etc. I encourage all these women who are in this category to speak with your plastic surgeon, meet with somebody who's done these surgeries, who performs them on a regular basis, have a conversation to talk about your goals and desires. Revisionary breast surgery, this is another aspect. Some women have undergone augmentations, mastopexy before, and they can have breasts that can over time look a little bit deformed. And if you look at this woman's chest, you see that she has an implant that's sitting very high, and she has a lot of breast tissue hanging underneath of her breast. We here can take a look at some folks and then be able to kind of recreate and reshape their chest to give them a more natural look back through surgery, to help them kind of regain that confidence that they had before. And then lastly, combination procedures with breast surgery are very common and very commonly done in our surgery center, but also anywhere, I think, in the country with a board-certified plastic surgeon. When you combine breast surgery, commonly women combine that with tummy tucks, sometimes liposuction to various areas of their bodies. We're going to have a little bit more on this later on today, I think around 4:30, when we discuss our body talk. So be sure to tune in for that, and we're all very excited to give you guys more information about that. Now, next, I'd love to have Angel come on back over here, Angel. I know some folks have been submitting some questions, so why don't we maybe field a few questions here and there.
I've got it. I've got some questions. That was so informative.
Thank you.
So, some of the questions. How many years is it recommended to have your breast augmentation redone?
That is a fantastic question. The FDA tells us that women should undergo a implant exchange or revisionary surgery after 10 years of having a breast implant placed into their chest. While that may be the FDA's recommendation, the implants themselves don't just miraculously dissolve at 10 years. We have women that come into our office who've had implants placed 10, 20, 30 years ago. 30 years ago, and the implant is still good. So does it necessarily mean that if you have an implant put in today that in 7 to 10 years you have to have it changed out or replaced? That's not necessarily true. What's important is for you to develop a great relationship with your plastic surgeon. See him on a regular basis, once a year, once every 2 years. Do an exam on your breast and make sure that your implant is not giving you any issues that can be addressed through potentially an exchange, and they'll be able to help guide you whether or not you need something like that done.
Okay, next question. How do you determine which size is best for me?
And this is also probably the most important aspect of the whole trial process for doing breast augmentations. For a lot of women, the most important part is to figure out the volume. And you got to figure out what size is going to make you confident and happy with when you're wearing clothing. We have our folks come to our office, try on, we have a special bra that we ask them to wear, and we put in special sizers that are shaped as though the implant were placed underneath of their breast tissue. This implant allows them to visualize their bodies with the size that they choose. Also, it allows them to take a shirt that they might have at home or a bathing suit and put it on over top so they can truly ascertain what am I going to look like once this procedure is done and how much volume am I looking. So that's how we do it at our office here. There are many different modalities at various offices. I would encourage everyone to try to make sure that before you leave your surgeon's office that you feel comfortable and confident with your decision that that's going to give you the desired look, that you've had the ability to truly figure out what size of implant you would want to choose.
Right, right. How long is recovery? How much time off work for just a breast aug, say?
So breast augmentation, most women recover very quickly. For most women, the pain resolves within about a day or two in terms of the acute pain. There'll be some soreness, especially if the implant was placed under the muscle. Some women will have a little bit of pain in their chest and will be a little bit limited in the amount of mobility that they could have in their arms and the strength in their arms. I ask women not to lift anything more than about 5 pounds for about 3 to 4 weeks after surgery. I also ask women to sleep on their back and to sleep in an elevated position to help with the swelling acutely. However, most women, as long as they're not doing any heavy labor, can usually get back to work within about a week or two of surgery.
Great. That's very impressive. And then I love this question. This may be our last question.
Okay.
How do I know if I need a lift versus just an implant?
Oh, this is a great question. And this is something that is very difficult to explain using words. However, the important thing, as I was kind of alluding to in the diagram, a breast will naturally descend over time. And that descent is measured by the amount of distance between what we call the sternal notch and the nipple and the fold underneath, and as well as the base diameter of the breast itself in terms of the tissue that's there. For some women, that amount of tissue is something that you need to feel and see in an office. And if that nipple is located below the fold of the under area of your breast, meaning the nipple has come down below it, is pointing down or slightly off of the midline. For those women, more than likely you're going to need to have a breast lift done as well.
Great question. Now, before we close this session out, I want to let people know you call our office, 615-771-7718. You get a consult. So we're going to put you on the books. You get to meet with Dr. Sarosiek and the nurses. I also want people to know board-certified plastic surgeons, Dr. Sarosiek and Dr. Moore, they both do all of these procedures. Also know we're going to let you touch, see, and feel all different kinds of implants before you make that decision.
And that's super important for everyone to know. So make that appointment, come on and see us, and thanks so much for joining us today.
That's right. Thank you. Here we go. Welcome back. I'm so excited for this next section. The last section with Dr. Sarosiek and all things breast was so informative. This next one's going to be just as good. So we have Savannah, who is a licensed esthetician at our Mount Juliet location, and we have Kara, a licensed esthetician at our Cool Springs location. They are going to be doing a microneedling treatment on this sweet patient who volunteered her time. Now, this is a fascinating treatment, and it does so many great things for the skin, and they're going to tell you all about it. Take it away.
All right. I'm going to scooch on over here so Kara can get ready to do the treatment. This is Kara's patient, Crystal, and she's going to be doing the microneedling on her today. They've already topically numbed her skin for about 20 minutes, so that is something that goes into this treatment. And they've also already cleansed her skin and prepped it with alcohol so that everything's sanitary and ready to go. So microneedling is basically a collagen induction therapy treatment. So it works on lots of different things. It can work on fine lines and wrinkles, acne scarring, surgical scars on the face or the body, acne scarring, and just general facial rejuvenation, texture, larger pores. It can work on lots of different things. So a lot of people are a great candidate for this treatment, and typically it's something that you want to do multiple treatments. Usually we recommend 3 to 6 treatments depending on what we're working on the skin, and usually we would space those out about 4 to 6 weeks apart. So it would be best to come in for a consult with one of our providers to see if microneedling is something that you are a good candidate for. The only thing that we really couldn't do it over would be active acne. So if you have active acne, we would want to get that cleared up before we start doing the microneedling treatments to work on the scarring. So as I said, when you come in for the treatment, we do topically numb you for about 20 minutes, so that makes it not so uncomfortable. Everybody has a different pain tolerance and I get different responses for what people say it feels like, but in my opinion, I would say it's maybe a 2 on a scale from 1 to 10. It's not super uncomfortable at all. We treat all areas of the face, forehead, nose, cheeks, chin, upper lip, and we can even treat the neck if that's something that concerns you. But after we numb your skin, we remove the numbing and cleanse your skin thoroughly, prep your skin with alcohol, and then depending on what type of microneedling treatment that we do, we'll apply something topically to give the pin some slip. So for our regular microneedling treatments, we use our skin pin water gel. The skin pin is the device that we have here at Cool Springs Plastic Surgery. And so we'll either apply the water gel for slip, which has hyaluronic acid and just keeps your skin hydrated and gives the pin some slip, like I said. If you want to do an advanced microneedling treatment, we can add on a growth factor serum to your treatment, and that's going to stimulate even more collagen production in the skin and also cut down on your downtime a little bit. So we see fantastic results with that as well. Another option that we have only here at the Brentwood office is to add PRP to your microneedling treatment. So PRP is where we will draw your blood and spin it down to get the PRP out of your blood. And that will kind of be similar to what the growth factor would do, but just a little more elevated to stimulate more collagen production and cut down on your downtime. At the satellite locations, Mount Juliet and Cool Springs, we do offer microneedling with the growth factor, but not the PRP at this time. So after we apply whatever method we're going to use on the skin, we'll microneedle over each area. We can control the depth of the pin. So depending on where we're working on the skin or what the concern is that we're working on, we can really customize it to each patient, which is really kind of cool that we can do that. So Kara is, what section are we working on now, Kara?
We have moved across the forehead. I'm working on the left side of her forehead. So we've done the right side in the middle.
Okay.
And so I'm just looking at the skin for mild erythema or pinpoint bleeding.
Okay.
And We have done her forehead at a 0.5, and then the last setting I did is 0.75.
Okay, awesome. And Crystal, how is it feeling so far? How's the discomfort level?
It's extremely tolerable.
Pretty tolerable?
Yeah.
And have you had this treatment done before? Is this, okay, awesome. So y'all are doing it kind of a series?
Yes.
That's great, awesome. Okay, awesome. Usually the forehead can be a little more uncomfortable. It's a little more tender there just because it's right there on the bone. Sometimes above the upper lip can be a little more tender, but overall it's a very tolerable treatment. Like I said, you can treat the face and the neck, and then also surgical scars on the body can also be treated with microneedling, which is awesome. So that's basically kind of a rundown of microneedling. I think Angel has some questions, so if you want to come on and ask, we can talk about those.
I do have questions. First, before we even get to the viewer questions, I'm noticing that she goes along, she stops for a little while and does something. What is she doing when she's stopping? She may have said, but I may have missed it.
Oh, yeah. So basically, depending on how we do the treatment, I believe that she's applying the water gel and then doing the passes over that area and then stopping to prep the next area with the water gel and then changing the depth if she needs to and things like that. We do have to do 3 passes over each area to make sure it gets a good treatment, and the endpoint that we're looking for is just even kind of redness, pink to redness, and maybe a little bit of pinpoint bleeding. So when you leave, you'll be pink to red, kind of like a moderate sunburn, and you could have some pinpoint bleeding, but you won't leave a bloody mess or anything by that means.
And then how do you determine the differences that you were talking about in your pen?
Like the different depths and things?
Yes.
Well, different parts of the face the skin has different depths, so that's something we base it on. There's kind of general settings that we would start with for each area. And then also there's differences in, like, for example, men and women. Men have thicker skin than women, so we might start a little deeper with their skin. And then you can kind of customize it till we get to that end point that we're looking for. Or if we're working on scarring, we might choose to dial it a little bit deeper as well, because you need a little bit deeper penetration to cause those micro injuries to stimulate the collagen in the skin.
Great. That's such great information. So our questions then from some of our viewers, and you may have answered this one: what skin concerns does microneedling treat?
Yeah, so we'll go over that again. It's texture of the skin, enlarged pores, fine lines and wrinkles, acne scarring, and surgical scarring are the most common things that we're treating with microneedling.
This next question I think is fascinating. What is the difference between microneedling at home with a roller and microneedling in the office?
Okay, yeah. So there is a pretty big difference between those treatments. I don't typically recommend derma rolling at home for a few different reasons. One would be it's not very sanitary. So when you purchase those dermal rollers, a lot of times they're just kind of sitting out at the store. They're exposed to things that you wouldn't really want to introduce into your skin when you're puncturing essentially a wound into your skin. And even if it did come sterilized, you're using it multiple times, and we really can't properly sanitize the instrument in order to keep it clean. With our microneedling pen, we just have single-use cartridges that we use and dispose of for one patient only, so we're not using it over and over again. Even if you were to sanitize your roller with alcohol and things like that, there's just can still be things left on there that you don't want to introduce to your skin. Another thing would be when we're doing microneedling, like I said, we can control the depth with different areas. With the dermal rollers, typically they're at a pretty shallow depth, usually like a 0.25, which is really the lightest we go with the microneedling pen. So you can't really get deep enough penetration of the needles to get a whole lot of results. You might see a little bit of something, but it's not going to be as effective as the in-office treatment. And third, when you roll the derma roller over your skin, it comes in kind of at an angle as you're rolling the needles, and that can cause micro lacerations in the skin or tears, scar tissue that can over time be more damaging to the skin than helpful. When we do a microneedling pen, as you can see, she holds it vertically, and so the needles are stamping in and out at a controlled vertical method. So those are the main reasons, I would say. Seems like there was something else I was going to say, but now it slipped my mind. So if I think of it, I'll jump in.
Yes, I was going to say, interrupt me. That's perfectly fine. How often would a patient want to have this done?
So typically we prefer to do it in a series of 3 to 6 treatments, and you can space those out about 4 to 6 weeks apart, which actually reminds me of what I was going to say about the derma roller. Typically these companies that offer these derma rollers will suggest doing it once a week or multiple times per week, and really that just leaves your state in a constant state of inflammation, which your skin needs that time to kind of rebuild itself, and that's how we get that collagen production, is by creating that controlled wound to the skin, which stimulates your body's wound healing process, which then stimulates collagen production in the skin. So when we give it 4 to 6 weeks to heal, we're getting that optimal collagen production. If you're doing it multiple times a week or even every week or every other week, that could be a little too much for your skin. As well as the skincare products that you might use at home to derma roll in are not approved to be on live skin cells or go all the way down to the dermis. What we use here in the office is clearly approved for that, so we can do the microneedling with it. But like your vitamin C at home or whatever you have could cause inflammation if it's going that deep into your skin, or even something called a granuloma, which is basically like a foreign body in the skin. Your skin kind of attacks it. So that's another reason that it's not safe to use derma rollers. But yes, to answer the other question, 4 to 6 weeks apart for your treatments. And then once you've gone through that initial series, you can come in for maintenance treatments. I usually tell my patients to come every 3 to 6 months for another treatment, just to continue that collagen production and keep boosting it.
And so as we age, that collagen starts to kind of dissipate, and we kind of start to get the sag, and this is going to help to start building it back up.
Jumpstart it back up.
I love that.
And you know, even if you feel like you're too old and your body's not going to produce that collagen, it most likely will.
Yeah. Keep doing it. Keep trying it. Absolutely. Let's see. What areas can be treated with microneedling? I think you talked about that. Are there any other areas?
I mean, it can pretty much be done anywhere on the body for surgical scars and things like that, but the most common would be the face and neck for fine lines, collagen production. Acne scarring is really big, especially on the cheeks. It's really good for that.
Okay, great. Can I work out after microneedling?
We typically recommend avoiding very strenuous exercise or where you'll get really sweaty for about 24 to 48 hours after the treatment. You could do some light walking, things like that, but we don't want to get your body temperature up too high or cause any sweating that could get into those microchannels and irritate your skin.
Right. That's good to know. And can I use my skincare products after microneedling?
So you'll just use your skincare products as directed by us after the treatment, but generally all we want you using is a very gentle cleanser, so nothing with alpha hydroxy acids or active ingredients, beads, exfoliation, anything like that, just something very mild and gentle. And then you actually go home with that skin pin water gel that I talked about earlier. So you'll use that as kind of like your hydration moisturizer for a couple of days. And then SPF is a must after this treatment. You'll want to make sure you're using your daily SPF. So gentle cleanser, water gel, and the sunscreen is all you'll use for about 2 to 3 days. And then you can go back to your normal skincare products. Same with makeup. We don't want you wearing makeup the day of treatment or 2 days post, because we don't want to get anything into those open channels that we've created.
That was another good question that they were asking. And also, as we all know, I'm sure SPF is always something we do anyway.
Yes, whether you're getting microneedled or not.
So it's just that step you do every day, no matter what. Great question I have here. I'm taking Accutane. Can I get microneedling?
Unfortunately not. You would have to be off of Accutane for typically about at least 6 months before you did any kind of skincare treatment, whether that's microneedling, chemical peels. You just want to wait because your skin's in a very sensitized state from that medication.
Sure, absolutely. I'm still breastfeeding. Am I a good candidate for microneedling?
Microneedling is not recommended for pregnant or breastfeeding women, mainly because of the topical numbing we apply. It's a prescription strength, very strong numbing, and that's just not really recommended for pregnancy or breastfeeding.
Just to be safe, absolutely. How long until I start to see my results?
So that can take some time. It's not going to be instant results. After the first treatment, you might feel a little tighter. You've had it done, so you kind of know what it feels like. A little tighter. You might get a little bit of a glow that next week. But as far as working on finer lines and acne scarring and things like that, it does take time to see results. So I really like to tell people to really give it that full, at least the third treatment before we evaluate your results. You might see some sooner, and that will be great. But we want to give it time because we are stimulating the body's own collagen production, so that takes time to actually take place. But one cool thing is when you do a microneedling treatment, you will get collagen production for up to 6 months after we initially do the treatment and cause those injuries to the skin. So even after you get done with your series, you should still continue to see some improvement in your skin for up to 6 months after the treatment.
Also, that's one of the reasons also we take before and after pictures so that patients can see that for themselves also. I think when I look at myself every day in the mirror, I don't see what other people would see.
Right.
And so it's great to compare side by side my before and after.
Yeah, often people come in and they say, oh, I don't know if I see a huge difference. But then when I take their after pictures and show them, they're like, wow, it is a really big difference. It's such a gradual change that you don't always notice it super instantly.
Absolutely.
Like
and then last question for this, can the microneedling treatment be performed the day I come in for a consultation?
As long as there's enough time allotted, then absolutely. I would say if you're pretty confident that you're a good candidate and that you want to get the treatment done, I would let us know when you call to schedule that you want to get it done that day so we can allow enough time for that treatment. Typically, our consultations are only about 30 minutes. And a microneedling appointment is an hour to give proper time for numbing and things like that. So I would just make sure you communicate that when you schedule.
And that's the one thing I was going to say. When you call into the office to talk about microneedling with one of our awesome phone people, you could talk about that. Can I do my consultation and my treatment at the same time? And those phone people can be very helpful about that, and they would make sure and block the time so that you do have time, because you do want to numb before you do the procedure.
You want to numb.
We want numbing. We love numbing. So let's talk about the things you need to know. Go on, shop online. You could purchase one of the packages. We also have just a microneedling treatment for a discounted price. But like Savannah said, 3 to 6 treatments is optimum. Might be that you want to get the package again, have the money sitting on the account. Now, remember, we have licensed estheticians at all of our locations that can do this procedure, and I would recommend my family and friends to any one of them. They're excellent. Dr. Moore handpicks these ladies also. He knows who he's getting. He helps to start their training, and then he sends them on for more training. We're training. We're making sure that we know all we can know and that we're doing the best for our patients. So, click the link, do the shopping, and then call the office if you want to set something up. Can't wait for the next presentation. Thank you, Savannah. Thank you, Kara. Thank you, Crystal. You've done a great job. And see you in a minute. Okay, we're back. So for this next presentation, you're going to get to see two of our nurse injectors that are at our Cool Springs location. Susan and Chrissy are going to be talking to you about combination treatments. Susan and Chrissy, now they're both at our Cool Springs location, but Chrissy also does 1 day a week here in Brentwood, and that's Monday. But you call the office, we can get you on the books with them. They're both very busy. Chrissy is the newest member of our staff, came to us from Knoxville, and I have to say, many of her sweet Knoxville patients are coming to see us, but we can still get you in. So, take it away, girls.
Hey guys, thank you for tuning in to the open house. My name is Chrissy. I'm one of the aesthetic nurse injectors.
My name is Susan. I'm also an aesthetic nurse injector.
And today we're going to talk about combination treatments. So something that we know in aesthetics is injectables, which is what both of us do, always do a little bit better when we can involve the skin. So something Susan and I both believe in is involving the skin when we're creating a treatment plan for injectables. So do you want to talk about why?
Well, the healthier the skin is, the better the injectables will look. Botox can help relax the muscles that create fine lines and wrinkles superficially. Filler can add volume to the face when changes in fat pads and bone structure has caused volume loss. And the healthier the skin is, the better that those treatments are going to work.
So for instance, if someone comes in with a deep line set in their skin, we can relax the muscle with Botox so that we're not forming the line anymore, but we need to do something to the skin to treat it because sometimes Botox alone won't fully correct a line. So things that we like to do is just kind of the basics would be getting a patient on a medical grade skincare regimen. So Susan and I both like to have our patients on at least Retin-A or medical grade retinoid with Botox and then sunscreen in the morning. So other things that you can add to that would be growth factors, vitamin C, but that's something that you can be doing at home, kind of like your homework to the treatment, and then come in every 3 months for your Botox to relax the muscle.
And then along with that, topical skincare treatments, they're done by our estheticians typically in our office. Microneedling is a good way to stimulate collagen production. That's going to firm the skin and smooth out fine lines and wrinkles even more. Chemical peels will also help even out tone and texture. It all just goes hand in hand together.
So the moral of the story, I think, is if the skin looks bad, injectables won't be as great as they can be. So if we can incorporate the skin, everything else will look better and you'll get better results. I really like Halo. I just had one done, but I really like that, especially in the winter and the fall months, because especially with Botox patients, if we can get that muscle to stop creasing the skin and to do something to resurface the skin, we can really get a pretty result to improve those deep set lines. Same with microneedling too, which is a little bit less aggressive than Halo, but is another good resurfacing option. So what are your favorites?
The BBL laser.
Love that.
It targets brown spots and redness. It may take different treatments for different people with different skin problems. It can help treat rosacea, sun damage. It also helps build a little bit of collagen, because anytime you put heat into the dermis, you have collagen building, and it will even the tone and texture and just give a really nice, pretty glow to the skin.
I love that one. That's one of my favorites. So with that, you can prepay for packages, right, for the BBL, but in the summer months, you just want to be really careful before that treatment to make sure that you're not getting sun exposure. And then afterwards, there's really minimal downtime with BBL. With Halo, which is the resurfacing laser that I mentioned, there's a little bit more social downtime. So there's about, I'd say a good 5 to 7 days. You'll be red and puffy, but it yields a better result than just one treatment of microneedling, which is our other resurfacing treatment. That one can be done in a series though, and there's less downtime. So just get to your goal a little bit slower.
Yeah, you typically have about maybe 2 days or so of redness with microneedling, a period of dryness for a couple of days or so, and then it'll take 6 to 8 weeks for the full collagen production with those treatments.
And if we can get you on something to get your skin healthy, when we do both of those treatments, you will get a better result. So the healthier your skin is, the better it will respond. Basically, both of those treatments are controlled injuries. So we're injuring the skin just enough to get it to produce more collagen. And if the skin is healthier, because we've prepped it with good medical grade skincare, you can get better results. And something like a stem cell growth factor, which we love, the TNS Advanced Serum, that is like fertilizer for your skin cells. It's to stimulate collagen. It's awesome.
And topical vitamin C also is a skin brightener, and it will stimulate collagen as well. It's a good anti-aging product to add. Not every skin type can use vitamin C, but that's where your provider can help direct you toward the proper skincare for your skin.
Yeah, I think that's another benefit of coming in to office and having us look at your skin. It's all about finding a skincare regimen that you can tolerate and use consistently, because consistency is key, especially with some of those active ingredients that are really important, like retin-A. They really need to be used consistently, so to get the result that we want for you.
One of my personal issues that I was dealing with was fullness in the jowl area, and I had the Kybella injection. It's an acid that will destroy fat cells permanently. There's a little bit of swelling that goes along with it for about a week. It was painful a little bit, so kind of be prepared for that. And it has slimmed down this area for me very nicely. And then my co-workers have injected some filler in my chin area and some in my cheek area, and I feel like it gave me a nice lift. I'm turning 50 this year. I'm told I don't look like I'm 50. I've started using Botox in my 30s, and that, along with medical grade skincare and laser treatments, has really turned my skin around. When I was younger, I was in the sun all the time. I grew up in Florida. I was in the tanning bed, and I think I would be an old mess.
Looking pretty darn good.
I think I would be very sun damaged and looking much older if I hadn't have started doing all of these things. And I don't feel like I look done. I hope I don't look done to anyone.
You look awesome.
So it can be done very naturally. It doesn't have to look very plastic. And I hear the terms, puffer fish lips and cheeks that are too big. It doesn't have to be done that way. It can be done very tastefully.
Yeah, I think that's always the goal, to have a little bit of improvement but not look like you've had anything. And another good point of prevention, that's something we know now, and I think with aesthetics we're all kind of thinking that way, but if we can treat before things are bad, like Susan did, you said you started in your 30s, and that is a good testament to why she's aged so well. So same, I started doing Botox when I was 25. I actually was a patient for acne at the dermatology office that I later was hired at and started doing injections for. But something I like to talk to my patients about when starting retin-A, because that's the topical that they started me on for my breakouts, is I wasn't compliant with it, or it takes a little while to work. So when you're first starting out, I can say firsthand, if you're not consistent with it, you just won't get the results, because it takes a little while. It's working on the cellular level, so it's changing the function of your skin cells. And so to see a result that we can appreciate in the mirror takes a little bit of time. So
a little bit of commitment too, because it can be very irritating.
Yes.
It can cause redness and peeling, and you have to work through it.
Yeah, exactly. So I think that's another good point too, is like finding a strength that you can tolerate and then using it consistently and having realistic expectations of when to expect to see the results, and just hang in there and be patient. So we were going to talk about some topics or some areas of concern that really are best treated with combination treatment. So the first one we want to talk about are vertical lip lines. So those are lines that are vertical around the mouth, caused sometimes by smoking. Other times people just use that muscle a lot or drink out of straws.
Or sometimes it's hereditary.
Yeah. So those lines are so superficial, meaning they're in the skin. Sometimes it's best to treat them with a resurfacing laser or device like a microneedling treatment, and do that in a series to kind of soften them, and then we can go back in with fillers, a really thin filler that is appropriate to go above the lip, and restore the structural support to the lip so that it lays a little bit more youthfully, and then we don't have to put as much filler in that area. So that sometimes, if they're really deep, is a good one to do in combination treatment. We can also do a little bit of Botox around the mouth so you're not contracting the muscle. It's hard increasing the skin as much, so that's another good combination. What was another area that we like to do?
The area under the eye.
Yes.
I find it's sometimes challenging. Sometimes people are not a good candidate for filler under the eye. Botox can be used to relax some of the wrinkling under the eye, but if it relaxes too much, it can look very, very bad and end up looking like a saggy eye bag instead of the tightening that we're looking for. So I often will refer people to Cara for microneedling under the eye. Lasers under the eye works really well, a fractional laser. And Heather, I think, has been having really good success with the nano laser peel.
On the Halo machine,
on the Halo. And then the eye cream that I absolutely love is the Skin Medica Instant Bright. That has been really, really good for me.
I think that's something that people forget about a lot is the skin there is the thinnest on our face. So people want to come in and fix everything with a little bit of filler, which, like you said, a lot of times they're not a good candidate for. They just don't know that. And we can relax the muscle with a little bit of Botox, but if we're not doing something for the skin, it just doesn't look as good. And I think that's something they'll forget about. So I love that.
A lot of people will have their crow's feet treated and then still see the lines underneath and want to go a little further with other treatments to help tighten that skin, other than surgery. Sometimes surgery is going to be the best solution.
And that's something that I love about working here is that we really have every tool in the toolbox to use towards these areas. So if it is a surgical issue, we have 2 awesome surgeons to refer you to and have all the lasers and resurfacing devices. But something I think people, like you said, a lot of times will do Botox for we call them lateral canthus lines. So here's your canthus, so lateral to that. But Botox really only is helpful for the lines from here over. Anything under the eyes is either a volume issue or a skin issue. So if you're not a filler candidate, then we really need to address the skin, and that's such a common area for people. Under eyes.
What do you like to do for the smile? You call them smile lines?
Yeah. Yeah, go ahead. I love that.
I've actually had pretty good success with using a very fine filler and doing a certain technique with the filler, and it has filled them in. The very, very superficial lines just come in this way. Some people will use filler in a different way, but I find that putting little aliquots right down the whole line, much like you would do the vertical lip lines, has worked very, very well.
Yeah, so that's an area that she's talking about that's kind of full, or that as we age, we get a little bit more fullness in this area. So fillers can fill in lines, but like Susan was saying, in that area that it's already full that we don't want to accentuate, it's really important to choose the right technique and filler, but also those lines can benefit from restoring the mid-face to kind of lift the skin and resurfacing the skin. So, and then whatever we can't get a really thin filler there is really pretty to help soften those. So that's definitely in combination. Ooh, what about neck? I feel like neck and chest.
I was just thinking that.
Yeah, that's something that people forget about a lot. Was we focus a lot from here up, but this skin, just like our under eyes, it's one of the thinnest. So we see loss of collagen there sometimes first. So crepey skin texture or discoloration, the horizontal bands. Oh, her neck looks pretty good, but has been probably treated with some resurfacing treatments, and that's why it looks so good. But I think that is
Botox in the platysmal bands.
Yes,
that's really done good.
Game changer, yeah. And some of the really thin fillers can be blended with some neurotoxins like Botox or Dysport and injected in those lines to get a really pretty result. But I think too, resurfacing lasers, and if you have any discoloration, little redness or brown, it's really pretty to keep that area nice and even, and it's something that people forget a lot.
They do forget it.
And it ages us. So,
yes.
And it's such a good place to be proactive on if you're starting to see these things that we're talking about, being fine lines, crepey texture, discoloration, to stay.
Some people get the sleep lines coming down the chest.
Yeah, what do you like for that?
Probably laser is, I think, the best, but people do very well also with filler and some Botox sometimes. Just depends on how deep they are.
And the easiest thing, this area is so vulnerable to the sun. I think something that we forget a lot is to put our sunscreen all the way down the face. So that's really important too. That's just something you can do without spending anything extra, but really protect that area because it's so vulnerable. And anything that you can do to stimulate collagen there, using a neck cream at night in the morning, followed by your sunscreen, and then resurfacing if needed and lasering the pigment. So.
Well, I hope you've learned a lot today from our discussions with our virtual open house. Chrissy and I would be happy to see you in the Franklin location. It's newly renovated. We love it. It's absolutely beautiful. And we would love to see you and make a personal skincare treatment plan for you to meet your aesthetic goals.
And we're back. This is going to be a very exciting demonstration for you. So I have two of our nurse injectors, Olivia, who is here at our Brentwood location every day of the week. And then we have Chrissy, who is at our Brentwood location on Monday and our Cool Springs location on Tuesday through Friday. Excellent nurse injectors. Also continue to say, Dr. Moore has handpicked all of the nurse injectors that work for the practice. He starts their training, then he sends them on. They train. They work on safety and then the newest and the best information for our patients. We also are very good about natural results. We want you to feel good about what you get done here. So, mid-face filler, very exciting. Go ahead, ladies.
All right, go ahead, Chrissy.
Okay, so this was my patient who originally came to me and was interested in lip fillers. So after we consulted, I really assessed her face and had a conversation with her, and we ended up treating her temples and her mid-face and talked about how that was a priority before we moved to the lips. So we've treated one side of her face already so that you guys could see the difference. We did, if you look at her straight on, you can see that she has some temporal volume loss, which we corrected on her left side, which by doing that makes her mid-face look a little bit more natural and her whole face look more harmonious. We did come down in her lower face after we did her mid-face and did just a tiny bit to contour a shadow that she had and a little bit in her nasolabial fold. So it's not that we forgot about her lips, which was her priority, but after assessing her, we both decided that volume restoration was more of a priority than lips. So we're gonna do the other side. We're gonna do just her mid-face and not her temples, so you can see why it's so important that we did above and below that area too, to give her a more harmonious look. So.
Yeah, and by treating the temple, you can start doing your because I'm just gonna start talking. By doing the temple, it can also pick up the corner of the brow a little bit, which can make her eye look a little bit more open and a little more lifted. And Chrissy's right, when you blend the temple into the cheek, it helps it to look more youthful because a youthful face doesn't have a hollowed out temple. And if you add just to the cheek, because a lot of patients ask for that for lift and the temple's hollow, it's going to exaggerate that hollowing in the temple because the cheek's gonna have more prominence. So it's very important to treat them at the same time.
Okay.
Yeah, and so she's gonna do the right side now and just start with Voluma. Is that what you're starting with? Okay, I'm gonna take my gloves off.
So we're gonna do the little needle.
So Juvederm Voluma is what we're using for the cheek, and it's one of our favorite fillers for the cheek. It's a long-lasting filler, which is nice. It'll give you about 18 months to 2 years before your body totally metabolizes that. It's a firmer product that helps with lifting, which is why we like it for bony prominences. So the cheeks, the jawline, the chin, these are all very popular places to use Voluma because it adds really good structure. For the temples, you can use Voluma as well because it's a very deep fossa, it's a deep pocket. But other products do well in the temples too. Today we used Velour, which is a little bit softer product when you're putting filler a little bit more superficially. That's a preference. Velour is also in the Juvederm Allergan family. It's the same brand of filler, and it gives about an 18-month result. So it's a long-lasting filler as well. So when we talk about the different types of fillers, it's really important to pick the right product for the area you're treating. So you wouldn't want to put Voluma in the lips, for example. It's too firm, it holds on to a lot of water. It could give an exaggerated look. For lips, we like softer products and maybe products that don't hold on to quite as much water. So I really like Juvederm Ultra in the lips. I like Restylane Kiss or Volbella. Those are kind of my go-to options. And it really just depends on how much volume you want for which product we pick. So it's hard to say without meeting you which lip filler I would recommend for you. And I get a lot of questions about that is which filler do I need? Well, I need to meet you first so that I can recommend the one that's right specifically for you. Before filler appointments, I'll kind of go into what the whole appointment looks like. We have a couple restrictions that you'd want to know before scheduling a filler appointment. You can't have any dental work, really even a teeth cleaning for about 2 weeks before or after. And that's because they loosen plaque and bacteria into your bloodstream. We don't want that floating around when we're putting in a filler that lasts this long, 18 months to 2 years, even the ones that last 6 months or so. We'd have that restriction. We also don't want you to wear any makeup later that day after your filler appointment. So even if you're bruised or red, leave it be. Just let it stay open. Let all of those little holes in your skin close up. The next day you can cover anything up if you need to. If you've got any bruising that you want to try to cover, you can wear makeup. those are most of kind of the major restrictions to know about going into the appointment. You can have swelling and bruising, so it's important to give yourself a few days of downtime just in case you have those things. Don't have a wedding 2 days after your filler appointment. That might not sit well. Let's see. What else there? How you doing? How much have you put in her cheek so far?
About half a syringe.
Okay.
So we're going to switch to cannula.
Great. Okay, so Chrissy has been using needle so far. So when we use needle in the cheekbone, to really give it lift, you want that filler to be pretty deep. So typically we put it under the muscle right on periosteum because that can lift all the tissues that are on top of that. When we age, we lose volume lateral to medial typically. So when we see laxity in the midface, or more around the mouth, people will say, well, I want to fill these lines. This is what bothers me. But typically when this is what bothers you, this is what we need to do. We need to do maybe cheeks, jawline, kind of right underneath that cheekbone in the malar area. Because those areas will give a more natural result where that's actually where you've lost your volume first. So let's replace that before attacking the lines around the mouth. When you put too much filler right around the mouth, that can give a full look, and that's when people look a little bit more done or fake. So doing the lifting first helps you minimize how much you might need around the mouth. Don't get me wrong, we do fillers around here all the time, but you can do lesser quantities if you lift first. Let's see, what else? With a cannula, which is what Chrissy is using now, it's rounded on the end. So where a needle is sharp, you kind of make that hole for the cannula, and then the cannula can go in and it can decrease bruising and swelling by just putting that blunt instrument into the skin to place the filler at a different depth. So sometimes it's a little bit less painless. It can feel more like pressure than anything, but we use this method a lot when we're kind of fanning over a larger area. I get questions a lot about, again, kind of how we choose each product and what fillers we carry. So we carry hyaluronic acid fillers, which are the Juvederm family, we carry the Restylane family, and we carry RHA fillers. We also carry Sculptra, which is by Galderma, who does Restylane products, and that's the only non-hyaluronic acid filler we carry. We don't use it quite as often because it's not reversible, so it comes with some added risks with it. But we do use it on the body sometimes as well. It can help with cellulite and just skin texture across the chest. So it's a little bit different product. But the hyaluronic acid fillers that we use in the face, which are the Juvederms, Restylane, and RHA, are all reversible. So all of those fillers can be dissolved if it was needed for a safety reason, or if someone came in with filler that they didn't like that we need to get out before we start over, you can dissolve filler with Hylenex. Hylenex is an agent that just turns that filler into water, so your body absorbs it. Since the fillers are made of hyaluronic acid, it's actually pretty moisturizing to your skin. Hyaluronic acid is what lubricates our joints. It's in your body, it's in your skin. So when you give it to your tissues, you're kind of giving your tissues what it's asking for. There is cross-linking in fillers, and that's what kind of changes the thickness of it, but they are all hyaluronic acid just with different levels of cross-linking. Her body will naturally break down these fillers over the course of that filler's longevity. So the 2-year fillers will kind of slowly break down over that time. She won't wake up in 2 years and it's gone. It will kind of slowly dissipate. At 1 year, maybe she has half or a little less left in that area. Some patients will wait until their filler is completely gone to kind of redo or make another appointment for filler. I usually recommend coming back before it's completely gone so that we can maintain your result. If you wait till it's completely gone, you're also 2 years older, so you're probably going to need more than what we started with to give back the look that you were going for.
I kind of like it.
How's she doing?
I kind of like it.
Yeah, you want to kind of zoom in on her face and point out what you've done so far?
So whenever we're treating someone's midface and they do have temporal volume loss or submalar volume loss, I try not to restore them completely here, because if I do, then this area will look done because the areas beside them have such a volume deficit. Mm-hmm. So I want to make her symmetric, but just not fully restore this yet, because we're going to need to go back in and complete her temples and her submalar area before doing that. So I think she looks good for the first session. What do you think?
Take a look at her. Oh yeah, she's doing great. So yeah, if you kind of zoom in on her again, you can see again the difference in her temples. Since this temple was not done, you can see that this side's more balanced. Just the transition from temple to cheek, it looks more youthful, just kind of in that subtle slope as opposed to a more drastic slope on this side. So once she has this temple filled in as well, that's going to help just kind of balance out the way this side did. And it'll give her a little bit more lift when you do that too.
Yeah.
Yeah.
She has a really petite face too, so we were able to do this with not a lot of product. So
Yeah, how much did you use total?
So a little over a syringe on this side.
Yeah, so just a little over 1 syringe in that cheek, and this side you did about 1 in the cheek as well, and then a little more than 1 in the temple.
Yep.
Yeah, temples are extremely deep. If you look at just a skull, it really dips in the temple, if you kind of know what a skull looks like. So to fill that area out, it can take a lot more product than what you might anticipate for an area that maybe a lot of people don't notice. So putting a whole syringe in the temple is not going to make her look full there. You can see she still has that natural indentation because you don't want the temple to be convex either. A little bit of concavity is what looks the most aesthetic. But she did great. You barely bled at all, so that's good. Hopefully minimal or no bruising for you. Angel, do you want to come in and ask what questions we got on the video before or after?
I do have some questions. You keep going, do what you're doing. I'll be behind you, Chrissy. One of the questions is where all, and you may have talked about this, where all can filler be used?
Yeah. So it can be used in a lot of areas. The areas that we do in our practice, I'll kind of start from top to bottom, are temples, cheeks and around the eyes. You can go underneath the cheekbone if they're really hollow and kind of sunken in through here, all through the jawline and chin, smile lines, nasolabial folds, marionettes, literally everywhere in the face, the lips. You can do hands. We get aging hands sometimes where they've lost volume there. And like I said, Sculptra can be used in the body for more cellulite or texture. You can do fillers in the nose and the forehead, but for the extra risk factors, we just don't at our practice. Yeah.
So that was one of the questions that I had was about hands. So we do filler in the hands.
Yeah.
And then how much can you say about for the hands? Would it be more than 1 syringe usually?
Yeah,
that's what I figured.
It's quite a bit, just because this area is pretty large if you compare it to an area on your face. So I mean, even 3 syringes, 2 per hand is not unusual. It will go away a little quicker just with the hand movement. The FDA approved product for hands is Restylane Lift. And that one, they saw about 6 months in the hands, where face, Lift will get you over a year. So it's just a little bit different in its longevity, even though it's the same product too.
That's great. That's great information. Here's another one. Let's see. What's the difference between different types of fillers? You talked about that a little bit.
I talked a little bit about hyaluronic acid versus Sculptra. But out of the hyaluronic acid fillers, Juvederm, Restylane, RHA, there are different cross-linking, different cohesivities, different G primes. They hold on to different amounts of water. And there's too many to go through them all. But in general, the ones that are more hydrophilic, they hold on to more water, you don't want to put around like really close to the eyes. So that would be like Ultra and Ultra Plus, which are beautiful in the lips or around the mouth. Wouldn't put that right up under the eyes because it's going to make that area look puffier. On contrast, some other fillers don't hold on to as much water, and they do a little better around there. They give a little bit smoother look. Some fillers also spread easier, which is ideal for areas around through here. But maybe in the lip, you don't want a filler that spreads so much because you don't want it to go outside your border. That's where we get migration. So it really just depends on when you come in, what your skin texture looks like, and what we need to do for us to recommend the right product.
And that's so important. We do have people call and they'll say, I want to have a syringe of Juvederm, and how much does that cost? And we can certainly give that cost.
Yeah.
But we also like to say, we do want you to get in front of our nurse injectors, talk about the areas that you're wanting to treat, and then you may have an even better product than whatever they're asking about, because different areas need different products.
Exactly.
So
She wanted her lips, and we ended up doing her cheeks and temples.
with a totally different product. Yeah. And then that's also a thing that we're really, I believe, good about is having a plan of action.
Yeah.
You know, you've made a plan of action with Tara, and then moving forward, you'll have your next steps and your next steps.
Yeah.
Okay, another question. Let's see what we have. Would filler correct one-sided lower jaw or jowl puffiness or mild drooping, just on one side?
So it depends. I mean, yes, it certainly can lift and tighten that area, but if it's just on one side, it depends on, is that side more emaciated where we can add more filler and still keep them symmetrical? If it's truly just a jowl and the rest is fairly symmetrical, you might want to consider Kybella right into that fat pocket. It really does depend on how exaggerated it is. If adding more filler would then make the other side look asymmetrical, or we could just do a little bit on both. Jowls are a big one, a big ask when we talk about filler. And doing cheek filler can help with jowls because it lifts. Doing jawline and chin can disguise a lot of jowling. And I'll often do that in combination with Kybella. So then it's sometimes a little bit of both. Yeah.
And we have some great pictures even on some of our social media as well as our website that talks about that jowl shaping. So that's a great question. Does sunburn or sun exposure on the face lessen the results of fillers or Botox?
No.
No?
I mean, if you age your skin more, right, aged skin needs more treatment. But if you get Botox, it's not going to affect your longevity. Yeah. Yeah.
Like we talked about earlier, sunscreen being our step that we do every day, it shouldn't be an issue. That's right. Yeah. This is an interesting question we got. Talk about using filler to improve skin texture on the chest.
So Sculptra is very popular for that. You can do hyaluronic acid fillers there as well. My go-to treatment for chest texture is laser. Yeah. So not to say that filler can't help, but if you have a lot of sun damage and it's texture, not a lot of volume loss, I prefer to do a Halo BBL on you. Yeah. They both can help.
Which we had
Heather talked about that earlier.
Great information about the Halo BBL. And let's see, what is more effective in achieving a more symmetrical face? Botox, filler, combination of both?
Combo.
Great question.
Because if there's a width problem, you can do Botox in the masseters to help with the width of the lower face. If it's a brow problem, probably Botox to help raise or kind of even out some eyebrows. If it's volume through the cheeks or the lips, that's probably going to be more filler. But it does just depend on where it is. Yeah.
Yes, and Botox and filler are our good friends. We love them. So let's see what else I have. How often do you have to get filler in the tear troughs to help with the dark circles?
Yeah, that depends on the product as well. So for example, Restylane really popular in the tear troughs, where Restylane might get 6 months in the lips, an area that moves a lot. I always see that it lasts longer in the tear trough. So you could get a year. You know, a little bit of that depends on the person. Some people metabolize filler a little quicker. But for tear troughs, I usually estimate about a year before your body's really gotten rid of most of it.
Right.
Yeah.
And then I have one last question, and then I'll talk about our action points. How many syringes are typically used for jawline contouring?
Some of that depends on the person, of your preference and how drastic of a difference you want. I'll do as little as one in a chin, depending on how much volume they need. I have like half a syringe in my chin because I just needed a little bit. I had Emily do it. But if you're doing full jawline into the chin and you need some hollowing here, I might start someone with like 4 syringes if you're doing that much, and you can go up from there. What would you say, Chrissy?
I'd say the same. It's just a big surface base. So.
Yeah, all the way around. It's just a large area that you can only treat so much with one syringe, because one syringe is 1/5 of a teaspoon. If you think about that volume, you're like, oh, that's nothing. So when it's strategically placed, it can make a big difference, but it usually takes more than that.
That's a great point that you made, that one syringe is 1/5 of a teaspoon. I don't think everybody thinks about it. And when you look at that syringe, you don't think 1/5 of a teaspoon.
Right.
So that's a very valid point.
Yeah.
Good information, ladies. I feel so smart. But also know that all of our nurse injectors are so well trained, able to do all of these things and the other things that we've talked about also. So, once again, we have our package options available for filler. We also have a Luscious Lip package if you're just thinking about lips. I think it's called Luscious Lip package, which is a fun name. And then, so if you want to click the online shopping, you can do that and buy one of those packages. If you have any questions, excuse me, our nurse injectors are available to answer some questions. They may not can tell you specifically what you exactly need, but they can give you recommendations about the best package for what would best meet your needs. So, click on the shopping link, call the practice 615-771-7718, and we look forward to our next presentation. Yay. Thank you, ladies. That was great.
Yeah,
Thank you, Tara. You did very well. Okay, look who I'm standing in between, Dr. Moore and Dr. Sarosiek, board-certified plastic surgeons, the founder of Cool Springs Plastic Surgery, and Dr. Sarosiek. This is an exciting place to be. A lot of information right here. Our first panel with these two guys is concerning body. So they're going to take it away. I'll come in with some questions in a little while. Go ahead, guys.
All right, well, thank you guys again for joining us on this amazing educational journey that we hope you have been partaking in at home. So I'm Dr. Sarosiek, and this is Dr. John Moore, and we are going to be talking to you guys today about procedures that we do here at Cool Springs Plastic Surgery to augment or to help fix the body. So we're going to start by making one slight comment. The human body comes in many different shapes and sizes, and a lot of folks out there have become very attached to Instagram and all these modules where folks are able to submit pictures and imaging of themselves that's doctored and fixed. Be mindful that what one person might have had done for their body might not be the right thing that is correct for your body. Everybody's body is a little bit different. People come in pears, apples, all sorts of shapes. Yep. And I think the best thing for anyone to do is if you're questioning whether or not there's a procedure that might be right for you to help you attain some of your goals, go have a meeting. Go have a sit down with one of the board-certified plastic surgeons, have a conversation with them, discuss your concerns, and have them kind of help formulate a plan to help you achieve your goals. What do you think about that, Dr. Moore?
I totally agree with you, Conrad. The human body is wonderfully designed, and there are so many variations. And I think our goals are to help folks maximize their potential given their genetics, their health, and to encourage them to be as healthy as possible. And then there are things that they're out of their control as far as no matter how much working out you do, exercise, you will need some help. And that's what we're here for.
And that's what we're here for, and we're happy to help. And again, you know, take an opportunity to sit down with a surgeon, have a conversation, and make sure you address the issues that are concerning you, and have them help kind of point out things that they might be able to do to help you along your journey. So, this is a listing of things that we're going to talk about today. We're going to start at the top, kind of work our way through. Liposuction is probably one of the greatest inventions in modern time. Liposuction allows us surgeons to really shape people, right? Yep. Yep. We're able to virtually use it head to toe, right? Dr. Moore,
yes, sir.
What are some of these areas that we're able to tackle with liposuction?
We can do liposuction on men. You can do breast, tummy, back. And women would have the abdomen. You can shape that, sculpt it, make it look muscular. And absolutely change the shape of a person. This morning had an operation where we did liposuction with the tummy tuck, and it was so much fun because we literally changed this person's shape. And it is so gratifying and fun for us and encouraging to our patients. So the tummy, I've done calf liposuction, arm liposuction, the back rolls, and just to shape the back, make it look more athletic. There's just many uses of liposuction.
Thighs, we'll throw out thighs in there too. Yeah. A lot of women suffer from having some saddlebags on their sides of their legs. Medial thigh, the inner thighs, what we call the medial thigh. A lot of women struggle with the medial thigh. We're able to help out with that. So liposuction has become truly one of the greatest tools that a surgeon has outside of a scalpel, for sure, to be able to help people achieve some of those goals. And those goals, the reason why liposuction is so important is because the recovery from it is not quite as bad as it is from doing regular surgery, right, Dr. Moore?
Yeah, because in general the pain is less and you can get back to full motion very quickly, and you don't have to hide out as long with liposuction.
Very true. Liposuction itself is done utilizing very small cannulas, and those cannulas, we create holes that are probably between 3 to 4 millimeters. So if you think about it, that's smaller than a half a centimeter in distance. That hole can be utilized to reach a very wide area, which allows us to truly utilize those instruments to sculpt and to do things in places without leaving a scar along that area, which is a huge advantage for many patients. Sure. And for many people seek us out just for that reason. So liposuction, so versatile. We can pretty much use it anywhere. But then the truly big thing that surgeons can do is we can cut, and we can always remove things. Yeah. Now, there's a litany of procedures that we can do in plastic surgery. Mm-hmm. And then a lot of folks come to us saying, look, I want liposuction on my arms versus having an arm lift done. And a lot of times we're having to answer questions for patients about, hey, when is liposuction appropriate, or when do patients really need to have an actual procedure? And I thought maybe we could take a few minutes to touch upon that in a couple of areas to help people understand that, hey, this is when liposuction would work for you, but maybe this isn't a time and you really need to have it excised. So maybe let's start talking about with arms, right? Arms are very common. We see a lot of patients come in for brachioplasties or arm lifts, requesting to have liposuction. Dr. Moore, how do you make your decision? How do you decide?
First of all, brachioplasty or arm lift, it's a much more commonly performed operation now. Michele Obama, I think, stimulated a lot of interest in arm surgeries with her very great physique of her arms. She had excellent skin tone, and that's one of the things that helps decide about, does a person need to have a arm surgery where they remove tissue or just liposuction? The liposuction puncture wounds is right behind the elbow, and you can shape the arm in a patient who has good skin elasticity. In other words, they don't have loose skin. If you have skin that's not going to tighten up or is very loose, and if you got one of those arms where it moves around a lot, those patients need to have a brachioplasty or arm lift operation where you actually make an incision on the medial aspect of the arm or posterior medial aspect where it is generally very well hidden, and you can tighten up the skin and shape the arm with that operation. And so you decide mainly based on the amount of skin elasticity.
One quick question I would kind of throw out to you is, let's say we had a patient, there's a spectrum of age, younger folks, older folks. How does that play into your decision making? Are you looking at younger folks maybe having slightly better elasticity? What happens to the skin, do you think, over time?
In general, skin will have less elasticity as you age or have more sun exposure, but I don't really look so much at the age as I do look at the skin. And if the skin is tight and I think it would contract well, I would do liposuction regardless of the age. But if somebody's young and they've got very loose skin, maybe they inherited that characteristic, I would opt for a brachioplasty.
So very good point, and I think it's something that's very important to take away from as you go about your journey of discovering whether or not something might be the right procedure for you, is that there's not really a set rule. A lot of it is depending upon sitting down with a surgeon, having a physical exam, having someone take a look at your skin, your arms, and understanding your goals, and then making that decision together. So another thing that we talk about a lot is liposuction for the belly and for the trunk. We have women come in all the time and say, look, I just want liposuction on my belly. I don't want to have a tummy tuck done. How do you look at a patient? How do you make the decision about lipo's good, or I think you're going to need a tummy tuck?
The factors there are similar. How much elasticity does the skin have? The other things are, suppose someone is very young, they had a very large baby, and their muscles got stretched out. You can't fix that with liposuction. So that patient, you need tummy tuck. A lot of those patients will have loose skin on the bottom part of their abdomen, and the upper abdomen looks fine. And so that would be someone who you might do a mini abdominoplasty on, where you open it up, tighten the muscle on the lower part, tighten the skin up a little bit, and then do some sculpting of the areas that are healthy with liposuction to improve the outcome of the operation.
Absolutely, and I would agree with you 100%. There's a lot of variability. I think a lot of it, depends upon kind of the needs and what the patient characteristics are when they come in for an exam. Ultimately, our goal is to do an operation that's going to give you and able to accomplish a goal for you with the least amount of scarring and the least invasive procedure. So if we can accomplish and meet your goals and give you an abdomen that you're going to be happy with liposuction, that's what we're going to do. If we feel like to get to what your goal needs is we're going to need to make a little bit of a bigger incision, we're going to have a discussion about that and kind of help guide you in a direction that might lead down a tummy tuck, for instance. So
another factor that we really prioritize highly is what is the safest operation for the patient.
Yes.
And in some patients, a full abdominoplasty may not be as safe for, say, an older patient who has some heart problems. And then those patients, you might do a moderated operation.
Very true, very true. So comorbidities, different medical conditions that patients have, that patients suffer from, their past medical histories, all those things. Yeah. So again, meet with a doctor, somebody who can actually understand what's going on with you. So next stage, we're going to talk about thigh lifts. So thigh lifts are probably pretty similar to arm lifts, I would think, right? You know, you were talking about loose skin and trying to decide whether or not liposuction for the thighs is great versus doing an actual thigh lift, a vertical thigh lift. Sure. What do you think, Dr. Moore?
In thigh lifts, oftentimes I will combine liposuction along with skin tightening. There are different approaches. There's a vertical thigh lift, which we use a lot in patients who have had massive weight loss and they just have a tremendous amount of skin laxity. And so you can shape the thigh and then tighten the thigh with the thigh lift incision. I typically will use a vertical incision that's kind of posterior medial, and it's very hard to see from the front or the back. And so it doesn't keep you from being able to wear shorts or a swimsuit later on, and it will shape the skin pretty much all the way down to the knee if necessary.
I think you bring up a really important point. You know, combining liposuction with a thigh lift, for instance, is super important because a lot of times women not only will suffer with loose skin on the inner part of the thigh or on the front part of the thigh, but they'll have extra tissue or extra saddlebags on the outer part of the thigh. And I think being able to do those procedures at the same time can help improve that result and get those thighs looking even better than just doing an extension alone. So I think it's a really good point. Brazilian butt lifts, my gosh, they've been in the headlines now for a few years now. A lot of folks are very excited about this procedure. Initially on, they were in the headlines, national headlines, for maybe not so good reasons. There were some problems with Brazilian butt lifts, right, Dr. Moore? Yeah. People were doing them sort of in a very unsafe way. You want to talk a little bit about that?
Yeah. When that operation was done in its early stages, the anatomy wasn't well understood, and patients were at risk for fat emboli. That's where fat gets into the bloodstream. And since that time, we've learned where to go, where not to go. So the operation is much safer.
Much safer. And now utilizing fat grafting and putting that fat grafting not into the muscle on the backside of someone's rear end, but putting it above the muscle and underneath of the skin, we're able to help improve the contour of the buttocks without having to put the fat into the muscle, which is a great advantage. The risk of having any very dire adverse complications happen is much, 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 much lower. Folks tend to recover well, and we've seen a much improvement in the complications that have arisen from that procedure. We get a lot of patients ask for that. A lot of patients from the surrounding area here in Nashville ask us about Brazilian butt lifts. You know, how do you screen your patients? How do you decide whether or not it's the right procedure for the right patient?
Examining the patients, one, they need to have enough fat that they can move around. And that is one of the most common problems is folks come in and they just don't have enough fat to transfer to achieve a good result. The other would be, is it a problem of the shape of the buttocks or volume of the buttocks, or is it something that we need to tighten the skin with basically what's called a hip lift or dermal lipectomy of the hip, extended abdominoplasty, that type of approach. But primarily look and see what tools you have to work with, and that's the shape of the person when you start. The other would be how much fat they have that can be transferred. And if you shape the hips, flanks, back, you can oftentimes achieve a good result just with the liposuction portion of it, and then you get to use that as a supplement to the bottom.
And that is truly a great kind of caveat into the next maybe topic about this, is that a lot of women come and ask for a butt lift and they want to have a larger rear end. However, you know, there are some inherent dangers associated with it. The actual post-operative restrictions can be pretty limiting in that people can't really sit on that butt for a long time. It's hard to drive a car. You have to lay on your stomach or stand the whole time. So it can be very sort of disturbing to your natural environment. That's where liposuction sometimes can truly provide an amazing opportunity where you can do liposuction on the upper part of the upper butt or the lower back here and truly improve that contour and literally enhance the butt without even having to put fat in, and give someone an incredible result without the necessary restrictions that we would put on their activities for 6-8 weeks after surgery to get them to recover. So that's a great point. Sure. Now, another hot topic in body surgery, fat grafting, 2 hands or other parts of the body. Dr. Moore, what part of the body can we not fat graft? We can pretty much fat graft anything, right?
Close.
Close to that, right? So fat, as long as you have it, we can take fat out and we can put it somewhere. It really depends upon what people are looking for. We'll have some, folks ask for fat grafting to the hands, fat grafting to calves, fat grafting to their bellies to create abdominal musculature. Yeah. Where else do you think? What are some other amazing places
I was just thinking as you asked that question, I've put fat for someone who had a traumatic injury to the scalp. I've put fat under their scalp to help prepare for a hair transplantation operation. I've put fat into the nose to correct a nasal deformity. I've put fat in a calf where a lady had basically had the fat carved out of her calf, and we reconstructed her calf by fat grafting. We put fat into calves as an augmentation procedure. We've shaped abdominal muscles where you sculpt, remove fat at certain parts, and then you add a little bit to make the muscles, make it look like muscles. So those areas, breast, put in breast, and I do a lot of fat in the face, and at the same time, we oftentimes will do it in hands in Asian patients.
So many opportunities. Yeah. So liposuction. So this is a young lady who came to see us here. She had a nice tummy. She wanted to have a little bit of improvement in her contour of her belly. She wanted to get a little bit more shape, a little bit more definition. So this is kind of what we did. We did some liposuction on her flanks, her midline here. You can see that a little bit of liposculpting where we utilized liposuction instruments to create some contour, and it gave her abdomen, rather than being very flat and round looking, we were able to give her a little bit of definition so that when she's out and about, she has a little bit of contour to that belly. And again, sometimes we can do with liposuction. So this is
one more comment about liposuction is that in the past, and commonly people come in and say, "Doctor, take it all away. Just get as much as you can." Dr. Sarosiek just demonstrated why you don't want to do that. You want to leave fat where it's desirable and sometimes augment that and then sculpt around it. So we do much more shaping of the fat now than we do actually removing as much as we can. That's very unhealthy. So to remove everything, you want to leave enough that you're striving for smoothness and shape. So it's not, you don't want to take it all away.
Absolutely, absolutely. But we do get a lot of people that ask.
Yeah, they do.
Get rid of it all. I want to give it all up. Yeah. So let's go. So this is a brachioplasty. Dr. Moore, you want to talk a little bit about that, about doing the surgery?
Yeah, this lady here, just the comments that we just talked about as far as elasticity, clearly this patient does not have good skin elasticity. She has a tremendous amount of, in addition to the elasticity problems, of fatty tissue on the posterior arm. So she's been tightened up. One of the issues with when you take out tissue that's under tension, sometimes it will stretch out a little bit. And this lady's had a little bit of stretching out afterwards in the picture there. So one of the things with brachioplasty or arm lift is that the scars take about a year to develop obscure appearance to them. So that's one of the things that you have to be prepared for.
So tummy tucks, we do a ton of tummy tucks here. We do a lot of abdominoplasties. Great procedures, so much fun. A lot of times people think that we do tummy tucks just because people have a very large belly. And that's not always the case. Sometimes it's just about the skin, right? Somebody had a baby, they're able to get their muscle and their abdominal wall back, but the skin just won't go away, right? We've seen that happens all the time. Yeah. So sometimes we end up having to do it just for skin reasons. Yeah. Sometimes, one important caveat I'll mention is that, just because you have a tummy tuck and you've addressed the front of the patient, you can't forget about the back. And I can't say this enough. I'm a very huge proponent of making sure that we treat folks kind of in a 360 pattern. I know Dr. Moore is too, because the last thing you want to do is to make the front of your belly look amazing and leave you with something like this on the backside where you're struggling because bathing suits, pants don't fit you right. So important thing is, make sure that you look at the patient 360. So in this patient, while we're going to do a tummy tuck on the front, think about how simple that is. We talked about liposuction, how we can virtually combine it with almost any procedure. You make one little small hole right back here, and you're able to lipo all of that out, and you're able to produce that contour. Now, I can tell you this woman is going to feel so much better having this for her waist than for having that, and it's going to make her overall satisfaction much, much greater and much better. So if you're looking for a tummy tuck, talk to your surgeon about the flanks. This is not something that you should kind of put to the side. Make sure that people are addressing that, because ultimately it can leave you a little bit unhappy. What do you think, Dr. Moore?
liposuction has been a wonderful adjunct for body shaping and tummy tucks in that 20 years ago, somebody would come in with rolls on their back, and we really didn't have much to offer them. And now we do so many patients where they have those rolls on the back, and we can essentially eliminate those through tiny punch wounds.
Yeah.
And this lady here, she's sort of an example of that. Yeah.
So one other thing that people talk about a lot, and a lot of moms come to us here in Brentwood, we have issues with diastasis recti. So diastasis recti, there are so many gimmicks out there. These are 5 exercises. This is a diet that if you follow this diet, you're going to lose your diastasis recti. A lot of these things are gimmicks, and they're not really true. What happens in a diastasis recti is this, right? A woman, when you're born, and as you grow early on in life, your rectus muscles, these are your abdominal, your 6-pack muscles, they lie in the midline. They lie very much up and down on either side of your belly button. Yeah. When you have your first baby, they get a little bit stretched out. The belly has to get bigger to accommodate the baby. After you deliver the baby, they kind of recoil. And after one baby, a lot of times, women will have almost complete recoil of those belly muscles. But if you have 2, 3 children, or if you have very big babies, this recoil doesn't tend to happen. And folks end up having a very rotund or a protrusive abdomen that they can never get rid of. Women work out all the time. They go to the gym. They're on crazy diets trying to get that belly to go back. Mm-hmm. And in reality, it just never will happen. Yeah, and this is...
I would comment that this is really something that you just don't have much control over. You have patients or women who have had 5 kids and don't have any spread of their rectus abdominis muscles. They just don't have it. And you have another person who's had 1 child, they're really stretched out. Weight gain can do that same thing. But it's very much an individual response. And you can exercise all you want to. You can strengthen the muscles, and they'll work like a guitar string, where if you pull it tight, it'll straighten it out, but you'll still have a gap in there. So
this is where surgery comes into play, because with tummy tucks, we can actually take those muscles and bring them together and sew them together down the midline. Sure. And again, look at this woman's waist, right? Her waist is here. Here are her hips out here, right? Imagine sewing those muscles back together. They get that waist back. They get that waist back, and that waist to hip ratio helps to give a woman her curves back, helps to give her that appeal back. And again, combine that with a little bit of liposuction around the flanks. It makes for a pretty successful, pretty amazing procedure. Yeah. Here's a lovely woman who had a C-section done along her lower abdomen. She has a vertical component and a horizontal component. Round belly. She has a nice figure, but man, it's hidden underneath of all that. So we did a tummy tuck on her, pulled her waist in. She's got a waist. She's got some hips. She does have a scar along her abdominal line and a new belly button, but she's definitely a lot more comfortable and confident in her new new abdominal physique. This is another lady that came in, and I mentioned this earlier. She's got some loose skin along the bottom here. You can see stretch marks and loose skin. She wasn't concerned really with just a large abdomen, and just wanted to have a flatter, tighter abdomen with less scarring. So here we go. We pulled it down, took out all that the scar tissue, made her a new belly button, and then even did a little bit of contouring on her abdomen.
I'm going to point out one thing that people, when you do abdominoplasty, the amount of tissue that's removed basically is from the top of the belly button to down the mons pubis area. So it's a lot of tissue that gets removed, and this skin is pulled all the way down here. And so you still have some of the stretch marks. They're pulled under tension. They look better. But this, again, that skin that's down here used to live
all the way up there. Yep.
And that's how extensive it is and how much tightening you get.
So a couple more things. Another woman with some loose skin on her abdomen. We're able to get her abdomen kind of trimmed up. A couple other things. This is another woman who came in very large, had a very large hanging, what we call pannus, a very large area of her abdominal tissue overhanging her waist. We're able to achieve a pretty amazing result. We're able to give her a waist, give her some hips. This is about 4 months after surgery. She's got a new belly button, and I think this is probably one of the biggest things about abdominoplasties. To me, this is one of my things that I focus on so much, because this thing is the one thing that's going to be visible to everybody out there. When you're out there at the beach, when you're out there and you're wearing some kind of a bathing suit or underwear, whatever, this belly button is going to be visible. So make sure you know what your belly button is going to look like. For her, we kept it pretty normal. It looks great. Her scar's on the inside of the belly button. Overall, I think she got a pretty great result, and I think she's going to be pretty happy. Now, combination procedures, right? We'll sometimes combine tummy tucks and breast, right?
Yep.
So very possible. So breast work, belly work can be linked together, sometimes put into one, and that's always a lot of fun. Talk to your surgeons about that and make sure that it's appropriate for you. But if you have a concern about breast and belly, that can happen too. Recovery for these are some rules that they vary by surgeon. I don't like folks lifting over 5 pounds for a few weeks after surgery.
I let them lift about 20 pounds.
20 pounds.
Yeah. His arms.
I ask folks to kind of walk with a slightly bent posture for a couple of weeks to let things kind of heal. I put them in an abdominal binder. And, drains. A lot of people fear drains. They'll read a lot of crazy stuff on the internet about drains. My drains, come out of incisions, so they literally don't even hurt when they come out. I know there's a lot of fear about getting drains pulled and the drains hurt, but I think they serve a purpose. They're important. And having a seroma or a fluid collection form and not put a drain in, and then you have to have a needle put into your belly every 3 days, I don't think is a fun thing to do. I know you use drains as well.
We use criteria when the drainage gets down to a certain amount, we pull the drains at that point. So it's based mainly on how much fluid your body's producing. Right. And they don't hurt. They're not big, giant drains like we used to use.
Right. No, not anymore.
Easy to come out.
Well, listen, I think Angel over here has a few questions for us coming in hot off the press.
Yes,
Angel, shoot.
yes, I'm off the screen, but you can hear my voice.
Yes.
So that was so informational, and I do have some questions. You did just talk about recovery for a tummy tuck. Somebody asked about how long.
Okay.
Yeah. I advise patients to not do anything vigorous for about 3 weeks, and there's a lifting restriction. And vigorous to me means something that you break a sweat doing.
Okay.
I don't want people breaking a sweat for 3 weeks. And then I let people start easing into activity, kind of trial and error. If they hurt, if they feel bad, they wait another week. But I let people start activity, resuming muscle type strengthening stuff at about 3 weeks, as long as they're not doing twisting motions or full sit-ups that would stress the suture, the muscle repair. And then at 3 months, pretty much full speed ahead. Most people are back to taking care of themselves at somewhere between the end of the first week and the end of the second week. Some people are a little bit longer, and then most people return to work unless they have a really vigorous job, is usually going to be end of the second week, into the third week. What about you, Conrad? What are your?
I think it varies. I think sometimes I'll be a little bit more conservative in that I kind of like folks to take it easy, maybe a little bit longer. I ask folks to not lift very much for the first about 3 to 4 weeks and just keep them kind of under that 5 pound limit. I don't want to put any stress on this. There's a lot of stitching that's done on the inside of the belly. And I just, I want them to kind of guard against doing anything that's going to increase that muscle tone. But overall, I think, a lot of it varies by physician, by surgeon, and a lot of it kind of goes along with, what you're comfortable with, what I'm comfortable with, and also with what your surgeon's going to be comfortable with. If you don't come to see us, you'll see someone else. It just depends upon their comfort level and what they're used to doing. Look at their results, look at how they're doing before you make a decision about who you're going to be with. Because ultimately, I think a lot of that post-operative care also has an effect about total outcomes too.
I'd like one more comment about that is that it really, again, it varies from person to person. If somebody has a very large tummy tuck, they may have a longer wait time. Or if somebody's a young, athletic person, I've had one patient who had a bunch of livestock. She was out the next day doing it.
Wow.
I did a nurse once who just had to get back to work at the hospital. She was back at the hospital in about 3 days.
Yeah.
So I'm not advocating that, but I'm just giving an example of it's so variable between patients.
Absolutely, absolutely. So another question, how long does lipo last, and is it something that you have to get redone in a few years?
Depends on how good Thanksgiving and Christmas are. If you take care of yourself, liposuction, you're actually removing the fat cells. They don't come back.
Yeah.
But the ones that do remain, they will keep doing what fat cells do, which is store fat. So, Conrad, you want to add
listen,
to that?
that's absolutely true, but I'm going to shoot one off of that and say, Dr. Moore, when you fat graft, right, let's say we take fat from one place and put it somewhere else on the body, can that fat grow?
Yeah, it can.
Of course it can.
It can, because again, they're fat cells, they're graft, they're a live cell graft. If they pick up a blood supply and survive the initial period of where the graft takes, and you gain a bunch of weight, those grafts will gain weight.
Right, so that's important when you're putting fat into something like the face, the lips, right? If you gain overall weight on your body, your lips can also increase in size. So keep that in mind. Sorry, Angel, go off tangent, but give us another one.
That's good. That's fascinating. Along fat grafting lines, how long will fat fat grafting last? That fat that you've put in?
Again, it's a graft. If it takes, in other words, if it picks up a blood supply, that graft is yours for the rest of your life.
Oh.
Okay. So.
But at the same time, right, when we do fat grafting, we were always taught that about 30 to 40 to 50% of every fat, of all the fat that we graft will not take. So that's why we tend to overfill, put more in and let that fat that survive and produce a result.
Yeah. And the fat takes in some areas better than other areas too.
It does.
That, yeah.
And two more quick little questions. Two more. Is this a weight loss option, liposuction, or a tummy tuck?
I always encourage people to be as healthy as possible, and don't look at it as a weight loss option, because you want to be healthy. And if you do suction fat off and don't change the way you're living, you can, like I said, the cells that are there still, they'll find their equilibrium. So I do not recommend it for weight loss.
I will totally echo Dr. Moore saying, and I will say this, and I think this is one of the biggest things that we try to do here, is to let folks and individuals understand that we as plastic surgeons, we are not going to cure and fix all these problems. We can help you attain some of your goals. But once you're kind of recovered and you're out there doing your thing, it's up to you to maintain. And maintenance means having a healthy diet, having a healthy exercise regimen, having good support around you, eating good nutrition, eating foods that are high in proteins, eating maybe lower carbohydrates depending on what type of diet that you're on. You got to make smart choices, because we can do amazing things for you, but I've seen it, I know you've seen it, you can do something incredible for somebody and then they kind of go in a different direction. A lot of times they'll lose that amazing creation that you've made, and it's something that I think part of a well-balanced plan with good dieting, good exercise, can make for an amazing life change. But it has to be combined with those things.
Right. So we're going to take a very quick little break to switch over our technology. Just let people know that they can call, make a consult with our two amazing plastic surgeons, and then we'll pause for now and be right back.
Thank you, guys.
Thank you.
Hey everyone, it's Dr. Conrad Sarosiek here. I'm joined by Dr. John Moore, and we're here from Cool Springs Plastic Surgery. Thank you guys so much for joining us today. We're excited to bring you another talk. This time we're going to be talking about face, right?
Yeah, face.
So let's kind of get to it. A lot of facial procedures that you can do on someone's face, and thank you guys all for kind of watching. This is sort of the list that we're going to be covering today. We're going to be talking a little bit about the brow lift, upper and lower blepharoplasty, facelift, a little bit of rhinoplasty, chin augmentation, and some facial fat grafting, some neck liposuction. We'll throw that in there, and just kind of go from there and see how the afternoon plays out. Yeah. So an important concept, right? The aging face. So this is sort of the trajectory. This is a graphic. Obviously, it's just images, but showing the trajectory of what happens to folks over time. Maybe we can get the guys to zoom in on us. Dr. Moore, walk us through kind of maybe what we're seeing here over time.
All right. So again, the numbers are just sort of references, but this can happen younger. I've seen patients have changes in their 20s, all the way up until 70s, 80s. But on the younger face, you're going to see that their face is full. There's a lot of volume, not many lines. They have their brow position is arched and higher. You don't see a lot of the signs of elasticity and volume loss, which progress. Here, the muscles that pull the eyes down in a frown will create lines here. As you lose elasticity and your brow drops down a little bit, then you have to use these muscles up here, the frontalis muscles, raising the brow to keep the eyes open. And we also see the fullness of the brow here. As you start getting older, it gets hollower here. We call this the A point. It can get really hollow in folks. You fill that in and you rejuvenate the face there. You lose volume in the cheeks, and that causes the skin, the inelastic skin, to start dropping down, causing a deepening of the nasolabial fold. The loss of elasticity in the lips, you start getting lines. The jowl area here, you'll get lines here, marionette lines around the mouth, and as you get older, even more exaggerations of that change. The corner of the mouth start dropping, the A point gets deeper, these lines become creases that are fixed rather than dynamic creases. You can't see it from this view, but the tip of the nose will start dropping down, and the nose and the ears continue to get bigger as you get older. Earlobes get bigger. You get pre-jowl hollowing. The chin, if you lose any teeth as you get 80s, 90s, 100, you'll lose volume in the jaw, and then that causes hollowing. Elasticity changes in the neck, where you'll get banding. So the big thing is loss of elasticity, volume loss, and then just other bony changes that happen as you get older. So those are a lot of the changes that would happen.
And that's a great tour kind of the aging spectrum that Dr. Moore just gave. And I think I agree with 100% of what he said, but I want to throw one thing out there just to add to the group to kind of understand. We have an incredible team of nurse injectors here. We have some in Cool Springs, we have Mount Juliet, we have here in Brentwood, we have Music Row, who literally can inject Botox and filler. And the reason why I mention that is right here. So there's a kind of a spectrum, right? We start here with a very youthful face, and we kind of descend down to a very, what we call an aged face. In the middle here are women who have slight signs, a little bit of what we call the 11 lines. We have some lines along the forehead that show us a little bit of the wrinkles there. We have a little bit of that volume loss here and that descent of that cheek fat here. We have some marionette lines. We have a little bit of lip atrophy. For these women, it is so incredible because folks can literally, without surgery, come into one of our offices and get Botox to help knock out these lines. They can get filler right here in the cheeks. They can get filler placed along the nasolabial folds. They can get filler placed into their lips and literally augment how they look without even having surgery done.
Yeah, and I would point out that we have many younger patients who, there are aesthetic standards in our society, and one of those is higher, fuller cheekbones and fuller lips. So a lot of younger patients who don't really have an aging phenomenon going on, but they want to create features that they don't have by birth. To accent those features. Yeah, so they want to accent the features and can actually create a look that is more appealing to them.
Yeah, absolutely.
Yeah.
So keep that in mind. You know, for a lot of folks, they'll start to see little traces of some folds here and there, you know, that you don't necessarily need to have a plastic surgery, have a facelift done. You can literally augment a little bit of that that volume by having a little bit of filler or Botox in your face, and it can help, we call, buy you some time, but it can also help you feel more confident without having to undergo an operation and a recovery period prior to potentially, you know, what could be in store for you down the road. Hopefully not if you're using good skincare. Heather, that's a shout out to you and our amazing team of estheticians here with Savannah and Destiny and Kara. That, you know, taking care of your skin is priority number one, especially on the face, right? Because that's where this all starts. A lot of it is all sun damage, it's smoke damage, it's damage from the environment pollutants. You know, blue light has come out recently talking about how our monitors these days are built out of these technology that's incredibly crisp and clear, and our monitors are so thin, but we're finding out that the light that they're emitting is actually aging our faces prematurely. I mean, that's a lot of things that are happening right now. I would suggest for anyone to meet with their estheticians, have a conversation with them. Make sure you're on a good skincare regimen and taking care of that skin, because you've got one and you'll never get it back. Sure. So let's move forward. Let's talk about brow lifts. Dr. Moore, this patient comes into your office, you're looking at her and she says, you know, I just don't like how my eyes look. I don't like how my forehead looks. You know, how do you analyze, you know, the person's brow? But then talk about maybe also about the different ways that we have of doing a brow lift and how you would approach it.
Okay. This patient has a little bit of drooping or ptosis of the brow. She also has a fixed crease centrally, and she has hooding of the eyelids. So she is a patient, and she's younger. She doesn't have a really much higher hairline. So if the hairline is very high, I use a direct or a pre-hairline type incision, because you want to shorten the brow length from the brow to the scalp. And some people, their hairline's very far back. So that's the approach I use on them. If someone says I'm going to wear bangs the rest of my life, I can use that approach.
And you're talking about making an incision up kind of along in the hairline, right?
Hairline,
right at the front of the hairline.
Yeah.
Okay.
I don't do too many coronals, because back in the scalp, where you actually pull the scalp down and then move it back, that moves the hairline back, and so that can artificially elevate the hairline, and I do not like that.
Give you a bigger forehead. Yeah. That's not a good look.
That's right. So that's the patient that I would use the pre-hairline or direct type brow lift. In men who have very deep creases, who have the same thing, brow ptosis or eyelids that need to be elevated, I sometimes will put the incision right in one of those creases, and they do wonderfully. In most patients, and in this patient in particular, the endoscopic approach, because she didn't have a high hairline, you make little incisions up in the hairline, use an endoscope, a camera, small camera that you go underneath the tissues, and then you weaken the muscle that causes the frown, and you can also elevate the brow and fix it with a device that holds the brow up. So those are the different types that I like to use. Primarily I use the endoscopic and then the pre-hairline.
Pre-hairline. So just to recap, right? So what Dr. Moore's talking about when he's talking about the endoscopic, in an endoscopic brow lift, you make about 3 little incisions, 4 little incisions, depending on the size of the person's head. But you make the incisions back in the hairline, so they're very far back. Nobody can ever see those incisions, and they're very small, and you're able to come down along the forehead using a small camera scope. It's called an endoscope, and that camera scope allows you to come down here, pull everything back up, get those brows up, kind of release some of the muscles that are pulling them down, and allow you to have a nice elevated, you know, very awake, very lively look. So that's a great way of doing it. You know, and Dr. Moore also mentioned that, you know, sometimes you can do a direct excision where you can literally make a cut kind of along the person's eyebrow. You can also make a cut inside of one of the forehead lines, like you can see on my head here. At some point, Dr. Moore, I might need you to lift up my my brows. But yeah, so there's many different approaches. An important concept from all this is make sure you understand which approach your surgeon is describing and the risk associated with them, right? Because making an incision, a coronal incision, you know, we mentioned that it can literally make your forehead look even bigger. So in somebody who has a bigger forehead already, you're talking about giving yourself an artificially very enlarged forehead, which can be a very disfiguring look for those individuals and not so great. So, okay, so let's move on. Let's talk a little bit about upper blepharoplasties. So a lot of women suffer from having hooding over their eyes where the skin is kind of coming down, covering their upper eyelids. Upper blepharoplasties are fairly straightforward procedures that we can do. Sometimes these procedures can even be done under local. In our office here, we have a state-of-the-art surgery center, which we're able to do surgery under general anesthesia, but as well as under local anesthesia, which is great for, for that comfort of our patients. They can come to one location and not have to go to a hospital or another surgery setting. We can excise a little bit of skin to help kind of open up the eyes, give them a little bit more of a youthful appearance, and kind of give them that more, awake and less tired look. Now let's talk about lower eyelids, because this is a very common thing that we see in patients. Patients come in with these, and I don't know if you guys can see this on the camera, but we've got patients coming in with these very large kind of bags under their eyes, and they're like, Doc, I hate this. How do I get rid of this? What are you going to do? Dr. Moore, what do you think? What's your thought? Why does this even happen to people?
Yeah. Again, you lose elasticity around the eyelids as well. The skin gets thinner, and then there are some connective tissue that's underneath the eyelid muscle, and it holds back the fat that's around the eye. And as you get older, that loosens up, and then you get these contours of the fat pads that kind of bulge out. So what we do is I like to transpose or move the fat around underneath in that crease there. We lift up the muscle, move the fat down to fill in that hollow, we call that the tear trough. And then out here, malar palpebral junction is that whole area, and I'll remove that fat. And I usually do it through one of these lines underneath here. It can be done through the conjunctiva or the lining of around the eye. Yeah.
So, bottom line here is, right, the bag or the bulge that you see at home when you're looking in the mirror in the morning and that light is shining directly from top to bottom, you're going to see a very accented big line, which I hope you're not seeing on my face today. As you see that line, the reason why you have that is that laxity in that septum that gives, and there's fat underneath of that that's actually bulging out. It's fat. It's back to fat, right? We do a lot of fat work in plastic surgery. So fat's kind of bulging out. So the way that we treat it, we make a little incision, take fat out, take some fat and re-drape it over that crease to get rid of the tear trough, and boom, there you go. Lower eyelid lift, and you look refreshed, rejuvenated, and happy. Now, there are some caveats to this. It's not for every person. There are certain caveats. There are certain eye anatomy things that you have to consider before attempting a lower blepharoplasty. Why is that important? Make sure you go see a plastic surgeon that has an understanding of how this anatomy works. Not everybody's a great candidate. For some folks, you will almost never get rid of that crease underneath of the eye, just because of the way that the orbital rim is built and the way that the eyeball is sitting in that socket. And it's important to have that discussion with your patients up front, to speak to them about the risks and the potential complications, and to also give them realistic expectations of what they can expect, because for some folks there's not much that you can do, and you can't promise them too much during these operations. So here's a good example. This is a young woman who had a little bit of herniation and some fat protrusion underneath of her eyes. She underwent a lower blepharoplasty. Incision is virtually non-existent, it's virtually gone, and you can see how she has a smooth junction between her lower eyelid and that upper cheek right here. Their tear trough is largely gone, and she's doing well. I'm going to jump to the next patient for the interest of time. So this is a patient who came in for a facelift. Dr. Moore, give us a quick round about how your approach, your thought process. Give us a little overview of what you...
So, Jed, a number of the aging changes that we just talked about. You can look at the eyelids. She has great, beautiful eyes with great lid position, but then she's got this tear trough, bulging fat here, some loss of volume in the cheeks. She has some lip lines, loss of volume in the lips, and then a lot of laxity down here. The platysma muscle is what creates these bands, and then she's got some submental fat, and then laxity with these lines on the cheeks. And so she was a patient that we did some fat grafting, facelift, and eyelid surgery on. And this patient had a mini facelift where for basically risk mitigation and quick recovery, we did a mini on her, which involves just the same features as a facelift, except for making the incision down underneath here and tightening those muscles up.
So yeah, here's a shot of her laterally, Dr. Moore. Show us how you put where do you put the incision on these folks?
Okay.
How do you?
So I like to, again, a receded hairline is it comes along with aging. So what I like to do is not put the incision back here in the scalp because it does pull the hairline back. I prefer to put it underneath the temporal hair here, and it goes, the incision hides in the crease here in front of the ear, in front of the tragus, and in front of the earlobe here. And then it goes back behind the ear, high up, and then dives into the scalp so that you can wear your hair back and still it hides the scar. On the eyelid incision, again, I use the incision that goes this underneath the eye, and then for the fat grafting, tiny little puncture wounds that you can allow you to access the cheek, the prejowl area, and lips, and so you can inject the fat. Yeah.
I mean, I do the same thing. I tend to follow the same trajectory in doing these folks around the ear. Dr. Moore, the lower earlobe, the little lobule on the ear, very commonly kind of a dead giveaway that someone's had some plastic surgery around the earlobe. How do you avoid it? What's your thought on that? Is there a way to fix it?
Yeah, if it happens, it can be fixed. But what I'd like to do is make when we redrape the skin up underneath the ear here, we pull it up pretty high, and I don't even close the lower part, and it'll heal and round up and create a nice rounded earlobe. Occasionally it will fix and pull down, and in those cases it's very easy to go back and do a little tiny touch up and correct that.
Absolutely, absolutely. Great result. You know, what's the recovery time like for you for a facelift? You know, it takes a while for the swelling to go down. Most times folks, you know, for me, I'll have folks come back one day later. We'll pull the drain out one day after surgery as long as there's no signs of any kind of bleeding. I'll leave one drain in overnight and just get rid of it the next day. And they swell up really good. I mean, the whole face swells up. And I also, and I know you do this too, we'll frequently combine doing facial fat grafting in the face, but also with some laser treatments, right? We have some incredible lasers here that we can literally resurface these lasers. Talk a little bit about that, Dr. Moore.
I will combine lasers in patients who have the fine lines or have sun damage, and just to augment the outcome. And it can be done on areas that, say around the mouth where you don't elevate a flap.
The perioral area is probably is one of the most common, because as we're elevating the flap to pull up here, we leave, you know, you want to leave everything here alone, but then coming over that area and doing some laser resurfacing, you can truly achieve some amazing results in smoothing out the fine lines. A lot of women over time develop very fine wrinkles right along the mouth, around the lips, around the perioral area, and doing a little bit of laser resurfacing, while it may be a little bit of a recovery process because that area will turn a little bit pink, a little bit red, might cake, might crust a little bit. Nevertheless, in the end, looks spectacular, and it's a very worthwhile thing to do while you're under anesthesia because you don't experience the pain, and afterward, it doesn't really hurt that bad. It's the actual process itself, which is why it's great to combine that with a facelift when you're under anesthesia. Okay, so let's move on. Ear reshaping. We see a lot of folks come in with what we call prominent ears, when their ears point out like this. And, you know, sometimes folks have had these ears point out for quite some time. They want to get them pinned back and get them a little bit more reduced. This procedure itself, fairly straightforward to do. The results can be dramatic when you look at this young lady. You look at her on the left side, she's got very prominent ears kind of sticking out on both sides. You look at her here after surgery and her ears are retracted, both ears are back. A more dramatic view would be one from the back here where you look at her hair, her ponytail, ears on both sides are sticking right out. Then you look at her here and her ears are retracted and back. And it can literally alter how somebody perceives themselves or how they view that others perceive them. Huge confidence booster for young people. You know, and most of the time this is fixed when kids are really young, right? But occasionally we see folks come through here, you know, a little bit later on in life. I think Barack Obama has very prominent ears. He still hasn't seen help yet for that. But, you know, a lot of folks still, you know, some will address this when they're really young with their kids. Sometimes, however, we do see them later on in life.
I'll address the timeline on that. The ear hits almost full adult height when you're in around 7 years of age. And so a lot of parents will address that with their kids when they start getting teased about their ears, just to help with their confidence as they grow older. And then there are a lot of adults just didn't get it done when they were younger. So we'll see a lot of them.
Great procedure. Recovery is pretty benign. The only thing that we ask folks to do is wear a little bit of compression on those ears to help everything kind of stay close to their heads so that the ears have a chance to recover. Everything has a chance to kind of scar down so that they can remain in place. And I think for most folks, you know, I tell most of my patients that, hey, be careful with those ears. You know, you do have stitches in there. You know, hopefully nothing unfortunate happens, but sometimes, you know, a little bit of force on that ear directly pulling in opposite direction can kind of make it recoil. So try to avoid that if you can. Keep those ears nice and protected. This, you know, COVID has done many different things to the world. It's done many things to Nashville and our community here. One of the interesting things that has occurred because of COVID is that everybody's doing Zoom calls. Everyone's doing FaceTime, Zoom calls, and everyone's looking at themselves with their computer sitting on their coffee table while they're enjoying their morning cup of coffee, and they look at themselves and they see a double chin. And for us, you know, we've seen an incredible influx of patients coming in asking to have their necks fixed, or what do I do about this, doctor? I've got a lot of extra skin. I think I've got a lot of fat in my neck. I have a double chin. How do I get that fixed? You know, and there are two ways of doing it. There are two ways. There's a liposuction, and then there's a neck lift. And there's a lot of differences between those two ways. And I think that it takes a specific patient to be a candidate for one versus the other. Dr. Moore, let's talk a little bit about that. Sure. Like when you're looking at somebody, how do you determine if they're going to be a good candidate for doing lipo versus, you know, maybe doing a lower, like doing a neck lift?
Sure. When I'm examining somebody for possible chin liposuction, the things I look for is their skin elasticity. Will the skin redrape smoothly afterwards? That is patient variable. And then there are patients who can. You think they're going to redrape well, and then they have some difficulty. Then you go to the staged operation, which would be a neck lift, if that happens. You also feel you do a pinch test. Mm-hmm. You feel how much fat is in between your fingers when you pinch that skin together. If it's fat, then they would be potentially a candidate for liposuction. If you feel in here and it's just not that much fat, but it's rather the muscle, then you need to do the neck lift type procedure where you actually tighten those muscles in order to create an angle.
Very true.
How do you evaluate them, Conrad?
You know, I look at my patients and I feel like skin tone, skin elasticity to me is number one. If somebody comes in with a large neck and I can pinch fat, and I've got fat in there and I've got muscle that might be a little bit loose, but I look at their skin tone and their skin tone is going to be good, I'm going to give them a shot with doing some neck lipo. We've had some incredible results where folks, you know, were kind of borderline and they could have gone one way or the other. We did chin lipo on them. I always tell folks that you know, chin liposuction is a procedure that's fairly minimally invasive to a degree. We're still doing surgery, so it's not you know, minimally invasive to a degree, but but it is, in terms of the spectrum, one of the procedures that's probably a lot safer. Requires only about 1 hour or 45 minutes of time. The incisions that we use for chin lipo or neck liposuction are 3 little incisions. Each one goes behind the ear and then 1 little one under the chin. And we're able to get all of that fat from just those 3 little incisions, so there's not really a scar. The downtime for it is absolutely minimal. Some folks will go home, they'll take Tylenol after surgery and no pain medicine, which is wonderful. Some folks might need a little bit of pain medicine, but usually folks within a couple of days are off. The big thing really is that when you think about this, you have skin, fat, and then muscle underneath. And once you pull that fat out, if that skin hangs, that skin will become loose and hang down on your neck. The only way to treat that is to get that skin to stick. And I always put my patients, like this young lady, in a chin strap. I leave her in that chin strap for about 2 weeks to help that skin stick itself underneath of her jawline, to give her that contour, to give her some definition here. I mean, you can see here, her cheek goes straight into her neck. There's nothing here, right? Here, you're starting to see, wow, there's a neck here. There's a little bit of a jawline here. Here's a picture of her from the side, right? Look at this. This is cheek going straight into neck. There's no mandible here. And look at her now. She's got a jawline. I mean, that's pretty incredible. This was just liposuction. Now, a neck lift for her could have been also a good procedure, and we have that discussion ahead of time. You know, I talk with my patients that, look, this is something we can potentially try and just see how you do. If you do great, this will be perfect. However, you know, there's a potential that you might not be super happy with the result, and if that's the case, then the answer really might be to do a neck lift. And, you know, it's, again, genetics are a factor.
Sure.
Yeah. This is another young lady. And again, I would encourage everybody, she's on our website. I would encourage anyone, if you're seeking out a plastic surgeon, and Dr. Moore, correct me if I'm wrong, but a great thing to do, go take a look at that plastic surgeon's website. Go look through their before and afters. Make sure you see some photos. You know, have a conversation with them. Make sure that it's somebody who you relate to, because ultimately plastic surgery is not a car wash. Plastic surgery is a journey, and you're going to be on it for a while. There's a recovery process involved. All these procedures need follow-up visits. They need care. And that essentially really is important for you to have a relationship with someone that's going to help guide you through that process and be there for you if you have a hiccup or not, and help you make the right decisions about your post-operative care.
Sure. Yeah, it is a journey, and we go through it with you.
Yep. Angel, how about do we have time for questions, guys?
Yes, a few questions. We do have time, just
Let's
a few.
do it.
One of them, how long will my facelift last?
Okay, you want to address it? Shall I?
So everything, there's a spectrum. A lot of literature out there discusses that, facelifts have a lifespan of 10 years. But ultimately, a lot of it really depends upon the person, the age that the procedure was done, their skin laxity, and then even post-operative skin care. So being on a good skin care regimen, maintaining the tone of your skin, all kind of play a factor in what you do. If you're a smoker, diabetic, somebody who is not using any skin care, you have a facelift just because you feel like you need a little lift and then you go back to your regular activities, chances are it's not going to last as long as somebody who says, look, I'm going to make a life change here. I'm going to quit smoking. I'm going to start a skincare regimen. I'm going to see our estheticians every single year and make sure that I'm staying on top of my skincare. I'm going to, follow up with my surgeon, make sure I have a relationship with my surgeon, and address the needs as they pop up. For those folks, I think it'll last longer.
Okay, I'm going to clarify what I think on that is that a facelift lasts the rest of your life. It's just that, unfortunately, the aging process also lasts the rest of your life. So you're going to have an outcome that the aging process starts. So it doesn't last just 10 years. To me, it lasts the rest of your life, and it will change. Your age will show quicker depending on those factors of elasticity, health, sun exposure, etc.
Absolutely. That's very interesting. One question I like was, will I still look like myself?
That's one of our goals, unless you don't want to look like yourself. But, you can look very natural. And one of the things the tools that we have to help with that is the volume replacement with fat or fillers. That, to me, has been the biggest stride forward in facelift surgery, is using volume to create very natural, unoperated looks.
I agree, and I think that's what people are looking for. Here's a question. Can you explain the general process of a chin implant, and do we do that?
Yes, absolutely. Chin implants are great option for folks to help enhance kind of the curvature of their face and help increase the projection of their chin. A lot of folks, some folks out there have very retruded or volume depleted chins. And the procedure for putting a chin implant in really involves one little incision that's made, what we call in the submental area, right underneath of the chin. And then you kind of dissect down onto the bone itself of the mandible, create a space underneath here, and then put an implant in to help augment and fill that space to give that chin an extra volume to help with your proportion or with your profile to give you better aesthetic view. Now, is a chin implant the right answer for everybody? It may be or it may not be. There are other ways of fixing the chin. For some folks, it might mean putting a little bit of fat in there. For some folks, it means fixing the nose. For some folks, it may mean just more volume in their face. So there's a lot of things that kind of are at play that you need to discuss with your surgeon before you jump to a conclusion that you just need a chin implant.
Very good. Who needs chin lipo versus who needs a facelift? That's one of the questions.
Yeah, I think we talked a little bit about that. We addressed a little bit of that, in terms of the laxity, the skin tone, kind of, whether or not there's really a lot of fat that's there underneath of that that neck versus just loose muscle.
Okay, and the last question, is it better to do multiple facial procedures at one time or separate them out? Great question.
I like to do what it will take to make that patient have a natural result, okay? If that means that all they need is their neck done, but a lot of times if you do one part and then there's a mismatch, and you don't want to have old-looking eyes and a very youthful-looking face and neck, or vice versa. So if you want to have a natural look that is balanced, and the other biggest part about it from your life perspective is you don't have to have multiple different recovery periods. So you knock out all your recovery periods at one time, and people, it doesn't disrupt your life as much. So that's what I prefer to do. Pretty much everything. I don't do rhinoplasty at the same time just because of the length of time it takes to do each procedure. So that would be my response on that one.
Yeah, and I would agree too. I think, a big bottom line is, you got to think about time commitment, length of surgery. Literature has shown in plastic surgery that the longer the operation, there's a higher chance of having complications. So, when you start combining a lot of things and the surgeries tend to be super long, it might not be the safest thing to do for patients in terms of their overall recovery, which again, we're trying to, we want everybody to have a safe, uneventful post-operative course. So you gotta kind of sit down and think about, each patient, look at their concerns, look at their issues, because some of the things that they might want to have done, let's say upper eyelids, facelift, something else. You can always do something potentially down the road later with less anesthesia or under local. You can always kind of find a way to help them get to that goal. But the ultimate goal that we have is to give them a safe experience that gives them, great results that overall makes them happy. So is that.
Great. So I just wanted to pop back in and talk to our viewers very quickly, just to let them know that I work for two of the smartest people ever, and it's a great place to work. They do a great job. Our goal is patient satisfaction as well as patient health, making sure they have natural results. Give us a call. We can get you on the books for a consult with Dr. Moore or Dr. Sarosiek, and they can talk about what you might want to do, face or body, all of the things. Also know that our packages are still available. If you're wanting to click on the link to purchase, that's also there. And then our phone people are available right now to help you if you have any questions about any of that shopping. So, way to go. That was
great day. So far,
so informational. I still am learning after all my years. So we'll see you in a second with our next presentation.
Thank you all for joining us.
Yeah, thank you very much.
Okay, so we're back. That was an awesome panel with Dr. Moore and Dr. Sarosiek. So much great information. We have one more great demonstration for you. Emily, one of our nurse injectors that's here at our Brentwood location, is going to be doing something that's a lot of people's favorite right now, and that's lip filler. Everyone is loving lip filler right now, and I don't blame them. I love mine. So many patients love theirs. So, Emily, go for it.
Take it away. First of all, I want to just say good evening and thank you all for joining us today. This is an event that we have put so much into, and we really appreciate y'all taking time out of your day to join us. The other thing I want to do is just thank our patients. Over the last 12 to 18 months, things have just been crazy in the world, and y'all have not missed a beat with us. We have tried to keep your experience here at Cool Springs Plastic Surgery as pleasant as possible while navigating through the pandemic, and we really appreciate your support. This is my patient today. We are going to be doing a little bit of lip filler. She has never had any lip filler before. She's never had any filler before. I don't know if you can see, maybe you all can kind of zoom in. Her lips are very thin, so she is the ideal patient for giving her a very natural look. We do not want to overfill her lips because they're not going to fit her face. When we do a consult, for anybody that comes in asking for lip filler, it's important to really assess all of the features of the face so that everything flows, everything looks natural, and we're not giving you an overdone look. So today we're going to build up some of this patient's borders. We're going to hopefully give her a little bit of an upper lip flip. And in addition to all of this, filler is going to really help hydrate her lips. And so some of the lines that you see around her lips and in her lips are going to be smoothed out. You ready? Mm-hmm. Okay. So I'm solo tonight with this. I am going to see if Angel wants to ask questions while I inject.
I'm coming.
That helps with the silence.
Yes. Yes, while you're injecting, don't be distracted. I'm just so excited for her lip filler because I just love lip filler. So I don't know what you just talked about, but did you talk about swelling?
So we did not talk about swelling. Swelling with any filler should be expected. We usually advise patients to expect the worst swelling in the first 48 hours. These fillers are made from hyaluronic acid, meaning that they love water, so they're going to pull some water in. Anytime that you have any kind of procedure done, injections, you're going to get a little bit of inflammation. So the swelling can definitely, stick around for about 3 to 5 days.
3 to 5 days. So sometimes we have patient call day after, maybe 2 days after, saying something's really wrong. I'm pretty sure you've put too much in.
Mm-hmm, mm-hmm.
So we try to tell them it's probably just swelling. Right. But if you're concerned, we're going to let you pop in and have a look-see.
Right.
But it will probably usually be swelling.
Some things that you can do to help reduce swelling is taking any kind of allergy medication, Allegra, Zyrtec, during the day. Taking a Benadryl at night can really help reduce some of that swelling. Your eyes are rotting. And I usually tell my patients I suggest that regimen for about 3 to 5 days after their procedure.
And this question's interesting. Does lip filler last as long as Botox?
No. So Botox is going to be about 3 to 4 months at the maximum. Filler actually will last anywhere, depending on which type we use, from 6 months to up to 2 years, depending on, like I said, which type we use. Now, around the mouth, lip filler does not last near as long as cheek filler or jawline filler. We move our mouth a lot more. It breaks down a little faster. So I would say the max amount that you would get from lip filler would probably be about a year.
I've been told my lip filler won't last that long. I'm pretty sure they're trying to say I talk too much, but we'll just not take that personally.
You're in the right place.
So, does lip filler have the same effect of limited muscle movement of lips as does the Botox lip flip? Maybe explain the Botox lip flip first.
Right. So that's been kind of a really popular procedure over, the last couple of years. The lip flip with Botox is essentially inhibiting that muscle from curling up and under when you smile. So you have a little bit more of the pink show. The lip filler does not inhibit the muscle movement at all. It just adds volume. So there are certain techniques that we use to inject to flip the lip with filler, but you will get a little bit more volume with the filler.
I do love a lip flip and then lip filler also. How long does it, we just talked about a syringe of filler last, so that was the same question we talked about as far as Botox. Botox is going to be much less time than your syringe of lip filler.
And let me add this, a lip flip with Botox, usually, you'll get maybe 6 to 8 weeks out of that. Yeah. Just again, because the muscles around the mouth move more often.
Good 2 months, hopefully. Is it okay to mix fillers in a certain area? Interesting.
Yeah, that is an interesting question. It is. Again, and Olivia touched on this in the previous injectable demonstration. We offer several hyaluronic acid fillers here in the office. They are all essentially the same main ingredient, which is hyaluronic acid. They are formulated a little bit differently. So yes, you can use different types of fillers in the same area. In fact, most of the time that is necessary to achieve the result that we're wanting.
Okay.
How you doing? Good.
She has a stress ball. Did you already talk about that?
I did not.
She's got a little stress ball in case she's nervous. I don't think that she's necessarily feeling very much because we do numb, and that is one of the questions. How long do you numb your lips before you start putting the syringe in?
We have a compounded numbing cream that is really very effective. We usually like to numb patients for about 15 to 20 minutes prior to the injections.
And it does help. It works very, very well.
It helps initially.
She agrees.
And then the filler itself has lidocaine in it as well. So after the first few sticks, which I'm not going to sugarcoat it, it can be uncomfortable. Once we get that filler in, it starts to infiltrate into the tissue and really numb up the rest of the mouth.
And it says, is there pain after lip fillers?
I would say that you could be sore, minimal soreness, nothing severe, and that would be something that you actually would want to contact your injector in case if you did have a severe increase in pain, we would want to know about that.
I found that the most bothersome thing I had with lip filler was just chapped lips, just real chapped lips.
So the numbing cream that we use can definitely dry the skin out. We do recommend trying to add a little bit of Aquaphor maybe to your skincare routine with the lips. Just to kind of keep as much moisture in as possible.
Right.
How you doing?
Good. She's doing so well. Let's see. I do have one more question. Can you build lip filler half syringes at a time?
So unfortunately, due to the sterility of opening the filler, we do not offer half syringes. Now, there is one particular filler that we do offer called Volbella. It is packaged in a half syringe. It's a very thin filler. It's very silky. It is meant to address the fine lines and wrinkles around the mouth. Oftentimes, patients who elect to use that are really just trying to combat those, some people call them smoker lines, lipstick lines, whatever. You're not going to get a ton of volume from that filler, but essentially that's the only half syringe that we offer. Most of the lip fillers are pretty versatile, so if you were to come in, purchase the syringe, and then we didn't use the whole thing in your lip, we can place it somewhere else.
Also, we've talked about on the phone with patients before that we do lip filler. We fill it almost with the whole syringe, but we save just a hair so that we can have a 2-week follow-up. Excuse me. And so just to make sure that things are even, is that going to be our protocol for most patients?
So again, we don't really like to break the sterility of the syringe, and per FDA protocol, technically, we do not save filler. However, our goal is to get you as symmetrical as possible during the first visit. If due to swelling, excess bruising, you come in at your 2-week follow-up and there's a little bit of asymmetry, we will touch you up and make sure that everything looks, as symmetrical as possible.
Right. I can really tell a difference.
Yeah. So my goal was to kind of do half of her lip so you can see that, you can see the difference in one side versus the other. This is not a huge difference, but again, she has never had lip fillers. She wanted her result to be very natural. She wanted a really pretty, crisp border. I think that she got that. And you can also see that in, the bottom lip that some of those lines have really been smoothed out. Our goal is to give you the most natural lip that we can. Some people like bigger lips, some people don't. We want to maintain your natural shape, but also, give you something that you feel like was worth what you spent. So I think that it's important to remember that if you have a very thin lip, we're not going to be able to give you a huge dramatic result with one visit. It's not safe, and usually it doesn't end up looking good. We always bring patients in and we can build volume as time goes on, but we do want to do what is best for the patient, what's safest for the patient, and what looks the best.
Very natural results. We've talked about that quite a bit all day long. Very natural results. We don't want people to be shocked. And most people don't want any type of filler or procedure that's going to be shocking. But I've also seen a funny little cartoon that talks about women get their filler and they go home and they're a little bit swollen and then they're scared. Then the swelling goes down, and 2 weeks later, I want more filler to go back to the swelling. I liked that fullness. Yeah. I love a good full lip. So she'll hopefully finish you, which she will. I'm kidding. Now, just to let our patients know at home, if you're still watching us, listening, and learning from this awesome lip information, we do have the Luscious Lip package as part of our selling that's going on over the phone or online. You can click on the link, do the shopping online, buy that package. It's going to get you a syringe of lip filler, which will get you this plus the other side. And then you'll call our office after you've made that purchase. You'll get on the books to meet with one of our nurse injectors. Now remember, all of our nurse injectors at all of our locations can do this procedure. Emily is here at the Brentwood location, and then we also have got Cool Springs, Mount Juliet, and Music Row, as well as here in Brentwood. Did I say all that correctly? Yes. Okay. Good. And so there's options for you. Emily does it as well as all the other nurse injectors. Now, is there anything else, Emily, before we close this session?
I think that's it. This is the first year that we've offered the Luscious Lip package at our open house, and we're super excited about it. It's not only giving you some savings on lip filler, but it's also offering the Lip Perfect Duo which is a product that includes, includes 2 steps, one that you use in the AM and one that you use in the PM. So we're super excited about that package, and if anybody's interested in lip filler, that would be the package for you.
That's right. I totally forgot that you get that Lip Perfect if you purchase that package. Great product. Also to say, our products are all on 20% off today. And so if you want to get any other products, that's available. Shop online, click the link, you can do that. And then we're almost through for the day. We're rounding the corner, ending soon. But coming up next, the giveaways, you won't want to miss that. We're giving away all of the great things that you registered for. So we'll be right back. See you in a second. Okay, our night is about to come to a close. It has been a great day. 12 to almost 7, many presentations by awesome providers.
Awesome.
Cool Springs Plastic Surgery has it for you. Remember, and then we've got all the giveaways. So you entered 2 weeks ago. You've started entering. We have all the different giveaways. So let's start the party now with all the giveaways.
I think that's a great idea.
Yep.
However, before we begin, this is our 3rd year of doing this incredible show. It's been 3 years now. We're doing this every year, and we've loved having everybody be a part of the show. This year's been especially tough. I wish all of you, who I'm sure most of you can visualize what our 3rd floor lobby looks like, as you've probably been up here. Right now, it's literally full of electronic equipment. We've got cameras, computers, we've got people out here, we've got lights, bright lights out here, we've got a production company helping us out. It's been an incredible event to put together. And there's been one person who's really been instrumental for 3 years in doing all of this. And it's been such a journey for all of us to have this person kind of head it all and wrap all the ends and make everything absolutely perfect. So without further ado, I want to bring Kendall up here. You know, we're going to have her draw out the names here. Kendall, come on up here. And just say hi to everybody. Kendall literally has put this show on for 3 years running now, every single year, including this year, which has been probably one of the most complicated, complex shows we've ever done. I mean, we're doing live streaming. So, Kendall, thank you for all that you've done for all of us. Thank you for what you've done for all the folks out there who came and listened and learned something new. And let's draw some names.
Well, thank y'all so much. I mean, y'all have been an instrumental piece in making the whole day run. So I get to do my job alongside some really incredible teammates. So thank y'all so much. All right, so we are going to start out with the Halo BBL treatment. It's a combination treatment. We've heard from Heather today how incredible this treatment is. We have tons of entries, so I'm really excited to see who wins. All right, and before I announce it, we will be reaching out to the winners by probably Instagram message, by email, by phone, however we can get a hold of you. So for the BBL treatment...
Is it Dr. Sarosiek?
It's not Dr. Sarosiek. It is Margot D. Margot D. will be reaching out to you. Congratulations. How exciting.
Good job, Margot D.
Wonderful. I'm going to hand it over now to Angel. And let y'all keep going with the show.
Oh, Kendall, come on. This is your show. This is your show. You're drawing out some names.
Okay, so I'm doing Coolsculpting 6 cycles.
6, not 1.
6
cycles.
That's huge.
That's a lot.
And so remember, Destiny did that presentation with that sweet patient who did her abdomen, and that was just one little cycle there. You could do arms, you could do chin, options. Okay, here I go.
All right.
Now we'll be reaching out. We'll find you. And I'm going to say first name, last initial, Megan L.
Congratulations, Megan.
We got you.
Megan L's going to get some cool sculpting. Oh, listen, we've got a lot of skincare. We got a skincare regimen.
Tell us a little bit about the skincare regimen, Dr. Sarosiek.
So skincare is the most important part of anyone's facial care. I would recommend for everyone to take a few minutes to come see one of our estheticians at either of our locations in Cool Springs, out of Mount Juliet, as well as in Music Row. Talk to them about your skincare. Talk about what your goals are for management of your skin. And it's never too early or late to start a skincare regimen.
Amen.
So get on that, start something good, get a little retinol going. Personally, I'm using a little bit of retinol under my eyes. I love it. I recommend for every woman over the age of 40 to start it. Intense Eye, Zeo, great cream. However, let's pull out the winner.
All right, let's go. Like Angel said, we're going to do first name, last initial.
Say it several times so that everyone can hear.
I'm being coached.
Yes.
Tisha S. So that's Tisha S. Congratulations. We will be in contact with you. We'll set up a customized Zeo regimen for you. Congratulations.
Yay.
Okay, so we'll give that
pass that one off.
All right, who's the next? What are we doing next?
Now we have, the $1,000 gift card.
Oh, the big one.
That is, you could do lots of things with $1,000 here at our office, and there's a lot of entries.
There's a lot of entries to this one. This was a popular one.
Our one winner for the $1,000 goes to Sarah C. Sarah, last name starts with a C. You win a $1,000 gift card.
Sarah C, congrats.
Sarah C, congrats. We'll be reaching out to you. Be looking for our information.
So
I'll
Sarah
pass
C,
that one on to Dr. Sarosiek.
Absolutely. All right. So, lip filler. I don't know how many women have done this in the past. If you're an adventurous type, you want to try something new.
We just learned a lot about it.
We did.
Amazing. Lip filler is incredible. So we've got our next drawing for a syringe of lip filler. Kendall, go ahead and pull out the magic one. Right. Who's going to be the winner of this prize pack valued at over $1,000? It's amazing.
Right, here we go. Tina B. Congratulations, Tina B. We will be reaching out to you to let you know that you were the winner of the lip filler. If you aren't watching, congratulations.
Okay, Olivia, we'll hand this back to you.
Tina B. Okay, y'all. Botox for a year.
The big one.
One of my favorite things, Botox. So I'm spinning it around. One lucky winner, Botox for a year. I know, a lot of entries. I know it, because we all want Botox for a year for free. Okay, and that is going to go to Jenny Q. Woo! Jenny Q. We'll be reaching out to you. Jenny Q, Botox for a year.
Awesome.
Woo! I'm so excited for you.
Congratulations.
Okay, so is that all of our prizes?
That's it.
We've given them all away. Yay, that's so exciting. So, last points of the day for all of you listening out there. Our phones will stop at 7 o'clock. If you have any questions before that, you can give us a call. We can help you purchase. You can still purchase online till midnight. So, midnight, that's going to be the end. The specials will be over by then. The awesome specials. And remember, these are our best specials for the year. Biggest savings for the year. What a great day it has been. We've learned so much. It's been so informational. And I just can't believe it's ending. Thank you for joining us. We love our patients at Cool Springs Plastic Surgery. If you're not one, please come along and be a part of it.
Join the family.
That's right. Be a part of our family. Anything else?
See you next year.
See you next year. Yay!
Good job. Good job.